meeting. But unfortunately, because budget scrutiny got moved, this meeting then had to get moved. So then it was a case of trying to fit it in around the council calendar. So I do apologise for that. And if any of you have brought your lunch with you, you're very welcome to munch away. We'll just try and make sure we don't call you for a question while you've got a mouthful of sandwich or something. Well, welcome everybody, and this is the third Health and Wellbeing Scrutiny Wellbeing Board of the Year. And before we start these proceedings, may I bring to your attention some housekeeping matters. There is no expected fire alarm testing today. Therefore, if the fire alarm sounds, please follow the fire and emergency procedure that are applicable for the council house. Basically, find the safest way out of the building, and then you congregate outside the court. Please remember to take your coat today, at least. This meeting will be broadcast live to the internet and will be capable of subsequent repeated viewing. By entering the Warspite room, you are, during the course of the meeting, committee members are consenting to being filmed and to the use of those recordings for webcasting. Please, can I ask that you all speak clearly and directly into your microphone when addressing the meeting, so that the online participants and the public can hear, and that your microphone is switched off when you're not using it. And as she quickly turns her mobile to silent, please, can we ask you to do the same? Can I have apologies, please?
Thank you, Chair. We've received apologies from Councillor Patrick Nicholson. Councillor Sally Nicholson is deputising today. Apologies from Mark Hackett, University Hospitals Plymouth. Stuart Windsor will be deputising today. Apologies from David Haley. Siobhan Logue will be deputising today. Apologies from Matt Bell. Karen Pilkington will be deputising today. Apologies from Gary Warbridge. Emma Crowther will be deputising today. Apologies from Dafford Jones, Tracy Lee, Professor Bob Fern and Sue Taylor. Thank you.
Thanks very much indeed for that. Anybody have any declarations of interest? Sally?
I have a daughter that works for Livewell.
Thanks very much. We'll note that. Right. Chair's urgent business. Well, I've got a couple. I'm sure a lot of you will have seen the Plymouth Live or the Herald today, which is announcing the fact that PDSE have taken over the contract for one of the buildings from the council, and there's some nice frontage of the building and a picture of a few of us standing with the keys handing over. So it's really, really great. Those of us that have been on scrutiny prior to the last couple of years know what an uphill battle it's been to get this city centre practice, and it's really exciting because it is a really good learning facility for the students that are down at the dental school, and very ambitiously they hope to be live come September this year. So it's going to be really interesting to see how they turn that building into a dental school with the various levels that they're wanting to do within the building. But yeah, great that we finally got there. I've also, there's a letter that we've had from Rob Nelders sent to me about the pharmaceutical needs assessment. Given the significant changes to the community pharmacy landscape in Plymouth, at the January 2024 meeting, Plymouth Health and Wellbeing Board accepted the proposal to go early with the publication of the next PNA, aiming for April 25, as opposed to October 25 deadline. However, this has not been possible for the following reason. The NHS Devon Community Pharmacy Strategy was due to be published in May 2024. However, as a result of the July election and the requirement to delay some elements of the consultation, it was not published until late November 2024. This strategy documents the outline for the direction of travel for community pharmacies in Devon, and as such provides the context for the PNA. Because of this, publication of the Plymouth PNA will have to be delayed by 3 months. So we're hoping July 2025. So, you know, it's unfortunate, but a lot of things got put back and with the general election. The other thing I wanted to raise was there is consultation going on about the 10-year NHS plan, which I'm sure Chris will be mentioning. But there is a session up at the Methodist Central Hall on Friday, or 3 sessions actually. And then there are various ways people can contribute, and it's going till February. So I think it really, we need to be putting it out to all our organisations to make sure we maximise the input from Plymouth. So look forward to hearing how that goes in the future. Right, now I want to say a big hello to those of you that don't normally join us, and I think if we just quickly go round and you introduce yourselves and say where you're from, so that those people that haven't been here before will at least know. Rob, we'll start with you.
Yeah, hi everyone, Rob Smith, Chief Exec of Improving Lives Plymouth and Chair of the Wellbeing Hub Network.
Good morning, Councillor Sally Nicholson from Plimpton St Mary Ward.
Morning, I'm Councillor Jemima Lang, Deputy Leader of the Council, and I'm also the Cabinet member promoting myself for Children's Social Care.
Just to break the mould, good afternoon.
Yes.
Tony Gravitt, Manager of Health Watch Plymouth.
Also good afternoon. So Emma Crow, the Service Director for Integrated Commissioning for Plymouth City Council.
Good afternoon, Siobhan Logue, the Safeguarding Children Partnership Manager.
Good afternoon, Chris Morley, Locality Director for Plymouth for NHS Devon ICB.
Good afternoon, I'm Michelle Thomas, I'm the Chief Exec of Live Well South West.
Good afternoon, I'm Karen Pilkington from POP, and think of me as Matt Bell.
Hello, Zoe Sydenham from Public Health Community Empowerment Organisational Lead.
Laura Alexander.
You'll have to go to a microphone to be able to make yourself heard. Sorry.
Laura Alexander, Head of Health Partnerships at the University of Plymouth.
Come and join us at the table.
Oh, I didn't want to take a seat that might be needed by someone else. I'm happy.
We'll sort something out. We'll get you settled.
Hi, I'm Hope Hughes. I am a Public Health Registrar, part of the Public Health team.
Welcome.
Teresa Cullett, Consultant in Public Health at Plymouth City Council.
Hi, I'm Rob Nelder, Public Health Specialist with Plymouth City Council.
Elliot Werngold, Democratic Advisor.
Professor Steve Madden, the new Director of Public Health at Plymouth City Council.
Which also brings me to say welcome to Steve, who's joined us in December. Well, you're very, very welcome. So hopefully Steve's going to see how we run this and how this goes, and whether we need to review as to how we do it. And I think that to me is quite a good thing to be doing now. So very timely. Right, so the minutes from last time. Are you all happy with the minutes, those of you that were here? Yeah, no arguments, good, I'm glad of that. Moving on to item 5, we have a question from a member of the public. Mr. Sheaf cannot be here today, so as per the custom, we will send him an answer, and then we will publish that answer in the minutes from today's meeting, so that you know A, the question, and B, the answer. Okay. Right. Brings us on to Steve and the Thrive 10 years. Who would believe it that we've been doing that? It's just amazing, isn't it? I mean, Michelle, you were around at the time. Yes, Tony would have been as well. So, Rob, I don't think you were you? No. So, yes. So, floor is yours.
Thank you. Thank you, Chair. Can I just first start by saying a huge thank you to the warm welcome I've received from partners across the system.
New to Plymouth, but I am Plymouth born and bred, so it's great to be coming back to the city. Just some context as to where I've come from. I've come from the integrated care system of Bath, North East Somerset, Wiltshire and Swindon. I was previously the Director of Public Health in Swindon, so really delighted to bring some learning from there. As the Chair has highlighted, it's a really great opportunity to look at how different health and wellbeing boards function. This will be my 4th health and wellbeing board that I've been involved with, so I think I've kind of got a grasp of the good, the bad and the ugly, and always keen to build on good progress. So, agenda item 6. It's a pleasure today to present the annual report of the Director of Public Health, but I acknowledge that although it is a statutory requirement for the Director of Public Health to produce and publish an independent annual report, I cannot claim this one as my own. I would like to say a huge thank you to Dr. Ruth Harrell for her years of leadership over her time as the Director of Public Health for Plymouth. This report has been the work of many, but I must acknowledge that this report belongs entirely to Ruth in her capacity as the Director of Public Health. As the Chair has highlighted, it's been a phenomenal journey for Thrive across the last 10 years, and we did a celebratory event in November, which feels like a lifetime ago now, to look back across the last 10 years, but also to then look forward. I'd like to say a huge thank you to Teresa Kulip, who will present in a moment, and to Jennifer Taylor for driving the Thrive programme forward and taking it to its next steps. As I've mentioned, in November 2024, we celebrated 10 years of the Thrive programme, and that also set out the ambitions for the programme for the next 10 years. The report provides an evaluation of the first 10 and proposes the strategy for the next. The board members are asked to support the recommendations in the report and to confirm member organisations' commitment to delivering Thrive for Plymouth. And I'll now hand across to Teresa to provide a further summary and take any questions. Thank you.
Thank you. So just a little bit more detail, really, I guess, to what Steve has summarised for us. So I'm sure many people on the board will be very aware of this, so I won't kind of labour on this too much. But obviously, Thrive has been kind of running for 10 years and was originally envisaged to tackle some of the inequalities in life expectancy that we were seeing in the city, and was framed around a kind of a social movement to kind of look at the goals and challenges that we had around health inequalities and address those. So it wasn't so much a campaign focused towards the public, but more about kind of galvanising and harnessing the collective effort across the city. And originally, it was structured around kind of health behaviours with a focus on specific chronic diseases that were responsible for 54% of deaths in Plymouth. But actually, Thrive over time kind of evolved, and that was in response to a number of issues. Firstly, kind of obviously all of the external factors and everything that happened in life since 2014, including the pandemic, but also kind of changes in some of the challenges facing our population around cost of living and increasing acknowledgement of the challenges faced by an ageing population. But also in terms of our kind of knowledge and understanding and approach, so that we then focused a bit more widely on kind of the wider determinants of health and appreciated some of the complexity that informs kind of some of those health outcomes that we were seeing. And also just revisiting the principle that this kind of starts with the individual and should be tailored to meet the health needs that they face and experience. And I suppose the wider thinking was around kind of building a public health workforce so that public health became everybody's business. So that was a lot of the work around kind of building a network and so on, which many people in this room will have contributed to or been part of. So just a quick look back over the last 10 years, we've kind of framed things around annual themes, and you can see here kind of, you know, a breadth of themes in different areas, such as the kind of One New Plymouth work led very actively by colleagues in Live Well, and increased kind of appreciation of the importance of mental health and well-being, and some work kind of around our food environment, housing and our living environment. So a real breadth of themes and huge amounts of success. This is literally a small snapshot of some of the successes that have come from the Thrive Plymouth network. There are many more detailed in the report, but it gives you a sense of kind of the huge breadth of work that's gone on and how effective that has been. In addition to those kind of, those named successes where we can talk to a particular framework or outcome, I think there's a lot of success around kind of the social movement element that Thrive Plymouth was seeking to engage, and building of a network around health inequalities. And there are some quotations here, but also more in the report, which speak to the value of the network in having a shared purpose and goal, and also working together and how much value that has brought to the Thrive Plymouth programme. And then other parts of the impact, we might be kind of thinking to ourselves, oh, well, it's very important for us to kind of directly measure specific indicators such as the number of people who smoke in Plymouth or other aspects. And I think that it's quite difficult to use these types of indicators in isolation, partly because, of course, Thrive Plymouth isn't the only thing that is working on all of these kind of health topics. But also because of the complexity that I mentioned earlier around what influences some of these outcomes. But what we do see since 2014, green arrows indicate that things are progressing in the direction we would want, is some improvements in some of these types of health indicators, but also some challenges that remain. Overweight and obesity remains a challenge in Plymouth as it does nationally. And increasing kind of negative indicators around kind of mental health and well-being that we continue to see. And I think just revisiting the original principle of Thrive was all about inequalities. And whilst as a top-line indicator we may say things are moving in the direction we'd like, I think that the inequalities do remain there, and that remains a challenge. So there's obviously continued work to do. So we refreshed the approach and have kind of come up with something that moves a little bit beyond just that focus on a kind of quite a medical thinking around health, and brings in some of those other elements that we identified as being really important. So continued work on some of those physical aspects, such as smoking and alcohol and diet and activity, which we all recognise are really key. So that's kind of our healthy body petal, but also bringing in more work around mental health support and support for some of our residents with more complex lives. So thinking about the importance of kind of healthy mind, but also connecting health into some of the work that's going on across the city around places, and the importance of all of these factors in influencing individual health experience and health outcomes. And then also speaking to work that is going on and the importance of communities. So thinking about kind of social cohesion and loneliness and how people engage with their communities and how that might be beneficial to their health and well-being. So a kind of much broader approach, I think, but putting the individual at the heart of our little flower here, if you like. In addition, we've kind of articulated principles that I think were always there, but we've just kind of updated those. And these kind of speak to many of the things I've already been saying about how we work together, how we ensure that the person is at the centre of everything we do, and remaining focused on inequalities, but also kind of re-articulating, I suppose, the importance of evidence in all that we do and the importance of collaborative working. So some new principles that will kind of underpin everything we're doing as we go forward. Obviously, there's been some strategic alignment with all of the existing delivery plans and strategic plans that we have informing our work in health and wellbeing across the city. So including obviously being a key part of the Plymouth plan work, but also these public health plans that we see operating already within our public health team and across partnerships. I think all of those kind of come under the umbrella of the Thrive Plymouth principles. So as Steve mentioned, we had a launch event in November. I know many of you were part of that event, but for those who weren't, the purpose of the event was really to look back at the last 10 years and kind of celebrate the successes from that, but also to start thinking about looking forward. So we had some kind of learning activities and thinking about how we work and how we might do things better. But some activities as well around how we choose our themes for the future and what the network really wants from Thrive Plymouth going forward. So the action plan, which is detailed in the report, which I know that you have in your papers, speaks to the importance of building a framework for us to monitor and evaluate what we're doing as we go. Excuse me. Also updating our website with all of these new kind of approaches and the new principles, but also thinking about how we plan for the future. And actually we've progressed our work on all of these since the report was written. So the monitoring and evaluation framework is pretty much finalised with some of those challenges around the indicators that I mentioned earlier. The website's all now up to date, so if you go to the Thrive Plymouth part of the council website, it now has all of that new content. In terms of planning for the future, the event voted for themes that they thought were key to take forward, and preventing ill health was the winner in the voting process. So we're now kind of putting together a programme of activity around prevention of ill health and thinking about what that might look like under those 4 petals. But also plans to now go out and re-engage with that whole network and ask them what does that mean to them and what would they like to be doing, and how we can kind of bring our work together on that. So that's all of my stuff. I'll stop sharing and happy to take any questions that anyone might have.
Thank you very much indeed for that. I mean, if we look at the rest of the agenda, there's several things within this that are covered anyway, and certainly from the Ageing Well side of things, I'm looking forward to speaking with Steve about that and how we then take that forward. But it's just amazing, isn't it, how the city has changed. Community builders are all part of that community engagement, and they're well embedded, aren't they, now within, and as you're going to tell us a bit more about in a minute, Zoe. So I think I'd be interested to know, I mean, particularly Rob, from your perspective, from improving lives plays a large part in this, don't they? And again, Tony, what feedback you're getting, and obviously anybody else to contribute as to how we're getting there. So Rob, do you want to start?
Yeah, in terms of improving lives, Plymouth is a small local, in effect a mini public health organisation. Often refer to ourselves as the presentation, the feedback and the strategy for Thrive through moving forward really dovetails and fits well with our own independent developed strategy. It really aligns comfortably. It really helps to smooth and have informed conversation with all system partners. But it is such a complicated landscape for the voluntary sector and the community to understand and to engage in effectively. And I think that's where organisations like ILP and the other wellbeing hubs can play that brokerage or intermediacy role between statutory agencies and grassroots organisations. We have to learn to be able to speak a little bit of public health, a little bit of the ability to speak with UHP, adult social care, to be able to translate that in meaningful ways for the communities that we're engaging with. So I feel really comfortable with the strategy, the direction of travel. It fits incredibly well. the work that we're doing across the Wellbeing Hub network, which Zoe is going to speak to in a minute, reflects this without any disagreement. It aligns with everyone's values, the way of working, making it work. It's a complicated bit because it's a complicated system. But yeah, we feel very comfortable with the direction of the strategy and are keen to engage and play our part in pushing forward on it.
Thanks very much. Tony?
Yeah, I think I would echo what Rob's just said, really. I think the Wellbeing Hub network is probably fundamental to thrive moving forward in the way it can reach grassroots. I think from a Health Watch perspective, bearing in mind we focus on health and social care, multi-disadvantaged individuals and access to various things is starting to trend with us in terms of health inequalities. A couple of weeks ago, we worked with a group called Gifted Women up at Mutley, and it was very interesting, some of the points that they pulled out, how they're struggling because of these multiple disadvantages to actually move forward. So we're pulling a report together from that hopefully can help inform, and we'll make sure that's shared. But it's led us to start thinking that for the next 12 months in the city, we'll probably focus on that type of multiple health inequality platform, if you like. So I guess we can help feed into Thrive.
Excellent. Chris?
Thanks. So the Thrive model is fantastic, isn't it, in terms of setting out that strategic direction as has been described in the model and approach. I think, as was described in the paper in the presentation, the links into the ICB and the ICS in terms of the long-term plan. I think it's a real opportunity as we do the refresh the joint forward plans. There'll be an update to that this year, thinking about both how the delivery supports the ambitions that are set out within that, but also the model and the description and the analysis helps inform that from a Plymouth perspective, that's feeding in at a Devon level. The other thing I think there's a real opportunity to build on through our local care partnership work is particularly around prevention, the analysis that we're getting through our population health management approach, how that aligns to the delivery of some of this. And I think as we think about our priorities for next year, there's some real opportunities to think how this comes together alongside the Thrive programme.
Thank you. Michelle, and then I'll come to you, Karen.
Yeah, thank you very much, and it makes me feel old, but it's great that it's going in the right in the direction it's going in. And I feel as though that everywhere I look, for the first time, you see strategies and plans that aren't at odds with each other. It feels like this is the right direction. Now, you know, whether you're in the ICB, whether you're in a health provider, social care provider, voluntary sector, you can see how just moving through all of that actually we've got a part to play, but it's how we work together. And I suppose my one challenge would be around digital. And have we all really looked at digital? And there's nothing better than a face-to-face and that human touch, but it's the future. You know, just a bit of a challenge to ourselves about how we all approach that and support others to do so.
I think it's also how do we use tech to do some of those tasks that could be done as well, isn't it? So yeah.
Yeah. And it enhances what we do as well. So.
Karen.
Do you mind? Is that okay? Can you hear me okay? Or do you want me to like lean in? Shorter arms. Yeah, so as somebody who kind of came into Thrive at the very beginning, not as a health professional or even as a member of a charity, but just as an interested member of the public, I guess what I'd like to say is it's been really accessible, and public health have been like super inclusive, I think, in the way that they've collaborated with like different sectors, including, so I support a very grassroots thing in Stoke Village, which is tiny, but they've been really supportive of us being able to like figure it all out, understand the landscape, And yeah, I just wanted to say thank you really for the inclusive approach of public health in being able to run the network, and that's definitely working, and long may that continue.
That's good to know. That's when we look at sort of what the plans are going to be, obviously we know that there are some areas that haven't done as well as we'd hoped. If we think about weight, healthy weight, etc. Presumably, Steve and Teresa, that's something that will be one of those higher up aims to be looking as to how we do it, and obviously Live Well come into that as well, because you manage the health, the weight, well, I don't forget what the terminology is these days, but you're managing that. So to me, this is all this joined upness, isn't it, that needs to be taken forward.
Yes. Yeah, and equally as well, the linking with mental health, so that, you know, it's that's what I mean, it's all coming, but to have that focus and really look at what the impact is. And I suppose as well, topically would be the medication that's available is not seen as an excuse to, you know, not do other things and to move those services forward.
Yeah, so echo those sentiments. I think the thing to highlight here is that we're not abandoning the last 10 years. We're building on it. So the key work around maintaining and achieving and keeping a healthy weight is still very much at the forefront, because as long with smoking as well, because those are the two key challenges that we have, particularly in that inequality space. So that work won't go, and it will look at how we build on it, particularly with our new health improvement offer as well. So there are great opportunities, and that links in very nice with Live Well as well.
And of course, we'll all be sort of reviewing how things go with the tobacco and vaping bill that's going through Parliament, because that will also impinge on what we do and affect what we do, basically, isn't it, as well? So it's quite an exciting time, really, with the 10-year plan, all of this and whatever, so that's good. Jemima, did you want to come in another thing about the children's side of things?
No, I was just looking at the data at the end, which feels like almost, hang on, I just lost it. Almost like it's all shut down, that's handy. Almost like a throwaway bit at the end, but there's data there around the 4 causes of death that we've looked at that's really significant, and I don't know how we kind of dive into that a bit more to work out what have we done in Plymouth that has affected that, what's happened nationally that's affected that, because there's some really impressive and significant data there around cancer deaths, coronary heart disease. So that was going to be my question, just are we able to kind of drill down into things that we've done that have been successful in those particular targeted groups to make sure we keep doing them, or is it a Plymouth thing? Is it a national thing? That's not clear to me.
Yeah, no, that's actually a really useful point to raise, because there were actually quite significant improvements in terms of our rates in relation to those 4 diseases. But I think that the challenge then is attributing some particular action or intervention to that outcome, and also appreciating that overall our mortality rate hasn't improved overall. So although we may see improvements in a particular cancer or whatever, actually that means that, you know, our population is facing other causes of kind of poor health, and not to kind of be forgetting those. So I think it's actually quite difficult to draw out a specific intervention or whatever that has helped. But I do think that kind of collective action work and that understanding of the value of the network is the kind of beginning of that. But I hear you, and I don't think it's quite as neat as we would like. It would be great to be able to draw that out.
Laura, you wanted to come in?
Thank you. Hi, I'm just sat here listening to a research project being designed. You've got the data, you've got the will, the appetite, the population involvement, and we've got expertise. we're also currently, and Steve, thank you for the email this week, looking at cardiometabolic health, which is a major contributor to all of those long-term conditions, thinking about childhood obesity through to working age adults and older adults. So I think we've got a lot of the pieces of the puzzle. The job next is to fit the university in as an asset to all of this.
Can certainly take that forward to, I can never remember whatever it is, yes. I know what I mean. The research collaborative, yes, we can take it forward to there and put that. So that'd be good. Thanks, Jemima, for that. Anybody else wish to contribute? No? Okay, well, thanks, folks. To me, we're on a journey. I get the feeling that we will never actually be at the destination in the end, because there'll always be new things coming in, but I think it's important that we're able to react and then to make sure that we are taking that forward to the ICB, the ICP, and all those sort of organisations to get that moving. Thank you for your contributions today. Okay, I'm now going to move on to dental access and oral health improvements. Rob, the floor is yours. Rob did try to escape from us, but we've still persuaded him to come back to help sort this out. Thanks, Rob.
Well, thank you everyone for the opportunity to come along and talk to you today. The paper that you've got in your pack, as Chair has said, is entitled Dental Access and Oral Health Improvement in Plymouth. I suppose what I wanted to say first off is that dental access isn't actually a responsibility of Plymouth City Council, it's a responsibility of other organisations. But the reason I've included that in the paper is because the Chair, Health and Wellbeing Board Chair, myself and others within the council have worked quite hard over the last few years to ensure that our residents do have improving access to dental services, and we'll hear a bit more about that as I go through the paper. So yeah, dental access and oral health improvement in Plymouth. There's 5 sections in this which I thought you would probably find of value. The first one is a bit about the dental task force, which we've got in the city. The second one is about the work that that we as a council have led on child poverty and our child poverty action plans and how that links to oral health improvement. Then there's a section on the oral health initiatives that we've got going on in the city, and there are a lot of those, so we should be really proud of that work that we do. Then a more recent development, the ICB's Oral Health Improvement Strategic Group or Steering Group, and we, along with others, are members of that. So I'm just going to make reference to that because that group has been really instrumental in securing some improvements in terms of oral health over the last 12 months in particular. And then finally, I just wanted to bring you up to date with the current debate around fluoridation of the water supply, or community water fluoridation as it's currently known. So I'll start off with just with a bit about the city's dental task force. So it was established in July 2023, and it was established for a number of key reasons. The first one is the number of people on a list waiting to be allocated to a high street NHS dentist. You may wonder why I've worded it in that way, but if you read the bit in italics, I'm not allowed to call it a waiting list, okay? So it's the number of people on a list waiting to be allocated to an NHS dentist. There are currently, there are probably over 23,000 people on that list, of whom 4,230 are children. So those are people who are aware that there is a list. They're the people who've gone through the process of ringing up and having their names allocated to it. It's an unvalidated list, so there are probably people on it who don't need to be on it anymore. There are probably people who've been allocated to an NHS dentist. There are probably people who've moved away. There may be some people who've died, but there are probably also thousands of people who don't know that list exists and haven't got the wherewithal to get themselves on it. So that may or may not be an underestimation of the current challenge that we face as a city. So that's the first reason why the dental task force was established. Also, as I've put here, more than 1 in 5 children in Plymouth have visible tooth decay by the age of 5. Each year, approximately 600 children have more than 4,000 teeth removed under general anaesthetic. That's entirely preventable. costs the local health system about £1 million a year. The bits I haven't put here are that those children, when they have their teeth extracted under general anaesthetic, have to have time away from education, and they normally have about 5 days out of education having those teeth extracted under general anaesthetic when you take into account the time that they need to be at home recovering. And it's not just the impact on the children, it's the impact on their parents or guardians, because they have to have time off work to look after these children as well. So it's not just the numbers, it's not just the children, it's the impact on education and the impact on the economy as well. So that's another big issue. 73% of adults had not accessed dental services in the preceding 24 months. 52% of children did not access dental services in the preceding 12 months. So those are the reasons why we needed to establish the dental task force in Plymouth. It's chaired by our chair here today. Mary Aspinall chairs the dental task force and has got senior leadership from across the city, the key partnership organisations in the city, and we've had really good input and support from the local MPs as well. The Dental Task Force has got 3 key priorities. The first one, this is where we are celebrating today, I think, develop a new dental facility in the city run by the Peninsula Dental School. So hopefully, as our chair said earlier, everyone will have seen the news today that the university has issued a press release, and that dental practice in Plymouth is going to open by the end of the year, and it's going to be truly a city centre dental practice. It's going to be in the First Stop Shop building, the old Lawson's building, where Steve used to work in his formative years. So smack bang in the city centre, where the people who need it most can get to it the easiest. And that was one of the criteria that we stuck with over the last however many years we've been working on it, to make sure it was truly a city centre offering where people could get to it. Brilliant news that that's going to open by the end of the year. So that was the first aim, if you like, of the Dental Task Force. The second one was to pull in additional funding to Plymouth City Council to enable it to enhance the oral health improvement offer available in the city. We've been able to do that. We submitted proposals. So when I say we, I mean myself, public health colleagues in Devon and in Plymouth submitted proposals to the ICB to ask them for funding to enable us to enhance the oral health improvement offer in the city. We argued the case basically that if you can't spend if you as an ICB cannot spend your money on the delivery of high street NHS dentistry, can we have some of it to put in place stuff that will work upstream to stop children in particular needing those services in future years? The ICB were fantastic and have supported those proposals. And in summary here, they're to expand the existing supervised toothbrushing scheme that we've got operating in the city, to establish or expand the fluoride varnish scheme. We've already got a fluoride varnish scheme operating in the city, but the proposal would expand that scheme in Plymouth, and to establish or expand the open wide step inside project in Plymouth. So, as I say, the proposals were Devon-wide, but I'm just talking as they relate to Plymouth now. So the ICB have supported those. Supervised toothbrushing is self-explanatory. Fluoride varnish, it's the application of fluoride varnish to children's teeth. Open wide step inside, for those of you who don't know, it's a resource that's been developed by the dental school. It's the story of Geoffrey the giant with toothache, who lives in Smeaton's Tower, and his visit to Daisy the dentist. It's brilliant for children, okay? There's a cartoon, there's a song, there's all this sort of proper teaching resource that goes with it. So children love it. It's been developed locally, and we're supporting it by rolling it out to schools across Devon as a whole. As I said, ICB have been fantastic in supporting these proposals and have allocated us £900,000 per year for each of the next 3 years to establish or expand these programmes in the city. The third aim of the Dental Task Force was to use some of that underspend to commission new services for high priority groups and those who don't have access to an NHS dentist. And that's really where the ICB's sort of strategic commissioning objectives come to the fore, around implementing dental reform, improving oral health, improving patient access to routine dentistry, and improving access to urgent dental care. So that's really where we've been putting a bit of pressure on the ICB. And in fairness to them, they've been responding very, very positively. So those were the three aims, but in recent months, the Dental Task Force has also supported or led other developments that should enable children and young people in Plymouth to access dental services. One of the things that, again, our chair, Councillor Aspinall, has been instrumental in is the primary schools offer. So PDSE, you'll hear this a lot, that's the Peninsula Dental Social Enterprise, that's the teaching arm of the dental school, okay? So they now offer free dental treatment for children aged 1 to 11 years in the city. And if children are not registered with a dentist, they can register with the Peninsula Dental School, and they will receive appointments or treatments up to the age of 16. Again, there is a waiting list for that. I think I'm probably allowed to call that a waiting list. But they've received loads of expression of interest. They've started treating children already, but it was another I suppose, partnership initiative in the city that really sowed the seed in terms of the publicity of that, because it was the Fit and Fed initiative in the summer where teams from PDSE went along and as well as offering activities for children and young people to do, they spoke about this offer. And then, of course, once it got onto the Plymouth Gossip Girls website, everyone knew about it. So it's just a good example of how going along to be getting partner organisations into that Fit and Fed programme to support families over the summer has meant that we were able, or Plymouth Gossip Girls were able to publicise this intervention in the city. So that's going really well, and there probably aren't that many places up and down the country that have got that free offer for children and young people in the same way that we have in Plymouth. The second thing which we've sort of picked up as the Dental Task Force has developed is this consent model pilot, because an issue which we became aware of was who is actually allowed to take children for dental care and dental treatment. And what we discovered was that most of the appointments were available during the day, and if parents were working, it wasn't a grandparent or someone else wasn't allowed to take the child along for their treatment. They weren't allowed to sign off the treatment. So what we realised was that we had a dental task force in the city, we had an initiative in place, and there was possibly an opportunity for us to act as a pilot for a slightly different consent model. So one of the MPs on the dental task force spoke to the Secretary of State for Health, and as a result of that, we're hopefully going to be able to take forward a pilot programme in the city for a different consent model, so it'll make it easier for children and young people to get the treatment they need as part of that school's offer from PDSE. So Dental Task Force has been going really great over the last 18 months, and we've got a further meeting of the Dental Task Force next Friday. Plymouth City Council, so moving on to the second point, and I'll speed up a bit from now, I won't spend too long talking about all these things. Plymouth City Council has got a child poverty action plan, okay, and since 2016 has been really supportive of the oral health improvement agenda in the city. The first child poverty action plan was put in place for the 3-year period 2016 to 2019. That had an oral health improvement component in it. The second child poverty action plan was put in place for 2019-2022, and as before, the council were really supportive of the oral health improvement agenda and made sure that oral health improvement remained a priority for that plan. And more recently, the 3-year plan that was agreed for the period 2022 to 2025, it was agreed that oral health improvement would remain a priority for children and young people too. We've also got this is a bit of a mouthful, a child poverty action plan, oral health improvement strategic group that pulls together all of the organisations in the city that are working on oral health improvement for children and young people, and there are quite a lot. We meet every quarter. I chair that group, and it's a fantastic opportunity to make sure there isn't duplication and overlap, because these initiatives that I'll refer to in a minute are very often provided by different providers in the city, so it acts as a fantastic way of coordinating that activity. In terms of the activity, item 3 that I've put in your, or the third section in the report, focuses on the oral health improvement initiatives being delivered in the city. The first one is called First Dental Steps. It was initially known as Dental Check by One, and the aim of that was to ensure that all children could see a dentist and their parents receive preventive advice by their first birthday. This has proven to be really difficult because there just isn't the capacity in the system for all children to be able to see a dentist. So that programme morphed slightly, and it's now been developed into a sort of multi-tiered oral health promotion initiative embedded in the Healthy Child programme. To cut to the chase, what happens in Plymouth is that health visitors are trained as oral health champions, so that when they go and see parents, when they go and see new parents, they can talk to them about they can give them oral health advice, they can tell them when they should ideally try and see a dentist, they can talk to them about diet, feeding, oral hygiene practices, and they can signpost to those services that are available in the city. So, fantastic initiative, First Dental Steps or Dental Check by One. That isn't unique to Plymouth. We've then got a supervised toothbrushing scheme operating in the city. It's delivered by a company called At Home Dental. They've got the contract across the region as a whole to deliver that and do a brilliant job with what they call their Big Brush Club in the city. I think we're expecting an announcement very soon that supervised toothbrushing is going to be rolled out nationally. We're sort of ahead of the game because we've already got supervised toothbrushing scheme in Plymouth, and thanks to the ICB, we've got funding to ensure that all schools and early years settings in the city will now receive that offer. So supervised toothbrushing scheme, brilliant. We've also got a fluoride varnish scheme that the Community Dental Service of Live Well South West operates in 24 schools in the city, been operating for about the last 10 years. They do a fantastic job. As I said, fluoride varnish application offered to children in reception in year 1 and applied by their teams of specially trained dental health educator nurses twice each academic year. We're hoping to expand that fluoride varnish scheme in Plymouth, but we haven't been able to take it forward quite yet because we are expecting national guidance to come out about how these community oral health improvement schemes need to be delivered. So as soon as that guidance comes out, then it'll be all systems go to expand the fluoride varnish scheme in the city. Open wide, step inside. As I said to you, the story of Geoffrey the Giant. We now have that operating from January of this year. We now Plymouth City Council commission PDSE to provide that service across all of Devon. Again, it's peer reviewed. It's got fantastic support across the system. And if you haven't seen it, there's a great cartoon that goes with it that will show you all the characters: Geoffrey the Giant, Daisy the dentist, and all those others. Oral health champion training. So again, PDSE have got the Peninsula Dental Social Enterprise. They've got a dental outreach team, and they offer oral health champion training to anyone who wants it. It's a really short training which is made available to service providers in the city. Just provides an overview of oral health, importance of prevention, and sharing key oral health messages with others. PDSE have also got resources which they share with partners in the city as part of their Chatterbox initiative. So if as a result of doing oral health training, you wanted to go and speak at a group about the importance of oral health, then there are resources that would support you to do that through their Chatterbox initiative. And then I think the final one is the interprofessional engagement projects, IPE, interprofessional engagement. This is where groups of dental students go out into the community. They're introduced to community groups. They have to meet with that community group. They have to hear what the community group have to say with regards to health and oral health. The students then come up with an intervention. They then deliver that intervention to that community group, and then they present it at a symposium later in the year. It's a fantastic experience for the students, because what it does, I may be speaking out of turn, maybe not. Dental students, okay, dentists are really bright, the dental students, okay. They're probably all grade 8 or 9 on the piano. They probably all captained the hockey team. They're bright kids, but they may not be as experienced as we would want them to be when it comes to working with people in Plymouth, who they are going to see when they treat them. So what this does is it introduces them to real people out there, the sort of people they're going to be working with when they go into practice. And the students love it because it takes them outside their comfort zone. The people on the receiving end of the interventions love it because they get to shape the next generation of dentists. some of the student projects have been recognised nationally and rolled out nationally as well. So it's a really important thing that the dental school do in the city, that IPE work. So item 4, we're nearly there. The NHS Devon ICB Oral Health Steering Group. Absolutely fantastic that this has been established because it enables us as public health professionals within Plymouth City Council to work directly with the ICB, who are the commissioners. And it enables us to work with them to prioritise where they should spend their money, I suppose. So it's we've got this, great steering group. They've got a number of priorities that we've signed up to as well: children, young people, vulnerable groups, mouth cancer awareness, and obviously data collection to ensure that we're prioritising the right groups at the right time. I've already mentioned the proposals that they supported: supervised toothbrushing, fluoride varnish, open wide step inside, and the £900,000 they've given us for each of the next 3 years. Given that success, we are going to go back to them and ask for more money. So we're going to develop more proposals about the groups that need it most. I've just mentioned a couple here. So people experiencing homelessness, asylum seekers and refugees. I think we're now calling these groups people who experience severe and multiple deprivation. That's probably a better catch-all. So what we're going to be doing is working with the ICB to work out which groups we should be targeting and prioritising, and then submitting proposals to the ICB, which will hopefully be accepted in the same way that the previous ones I've mentioned have been. So finally, I just wanted to briefly mention community water fluoridation. So you've probably all heard of fluoridation, but what it does, it involves adding fluoride to drinking water in those areas that don't have high enough levels of naturally occurring fluoride, and the level is 1 part per million. So that's the target. Plymouth water isn't fluoridated, so we don't have artificially fluoridated water in Plymouth, nor does it reach that threshold of 1 part per million naturally. Okay, so that's where we are in Plymouth. There are thousands and thousands of fluoridation schemes across the world. It's estimated that 400 million people receive artificially fluoridated water. In the most deprived areas, children and young people that receive fluoridated water have really good oral health. Okay, it makes that much difference. However, no new schemes have been implemented for nearly 40 years in this country. I think it's mainly the areas around the West Midlands, I think, that receive fluoridated water at the moment. So what's going on currently with water fluoridation? There are plans to expand water fluoridation in the northeast of England. And basically everywhere else in the country is currently watching to see what happens in the northeast of England. The proposals in the northeast went out to consultation earlier in the year. Something else that had to be extended because of the general election was the consultation timeline for that consultation in the northeast. The consultation report has been drafted and we're waiting to see the results of that. And basically all other areas of the country who are interested in fluoridation of the water supply are waiting to see what happens in the northeast before deciding whether to go in that same direction. Water fluoridation, I'll be perfectly honest with you, is quite a contentious issue. And I've listed some of the issues here in section 5. You can't opt out from receiving fluoridated water. It would be put in the water that comes through your taps. The anti-fluoridation lobby, as you probably know, are well organised and very, very vocal. Some other things to point out here: Plymouth's water supply comes mainly from the new Mayflower water treatment works, and that would probably be the most appropriate place for the fluoride to be added to the water. However, that water treatment works also supplies not just Plymouth, but parts of the neighbouring areas as well, so parts of the South Hams and parts of Cornwall. So Plymouth wouldn't be able to go it alone when it came to water fluoridation. We'd need a wider geographic footprint to go on if it was felt appropriate to do it. And so, as I've put here, the views of neighbouring areas and across the southwest are still unknown and would need to be sought. It might be months and months before the detailed regulations come in around water fluoridation. And I think, finally, what I wanted to say was that oral health improvement over the years that I've been working on this agenda has been really well supported by all parties in Plymouth. And I think if there were, if Plymouth were to consider water fluoridation in the future, there'd be real benefit in working on that on a cross-party basis. So that's just a quick run through of the report, which you have all got in your packs. So thank you very much, everyone.
No, thank you, Rob. That's been really quite enlightening. Jemima, it was you and me that stood up in council that started off a lot of this with you and your soya beans, pouring them from one receptacle to another. I don't think any of us that were around at the time will ever forget that. I think there were some people that were in the Guildhall at that time actually thought they were proper teeth, that we'd been up and raided them from the yes, Emma, from the hospital, but we hadn't. It was soya beans. Anything you want to say to this?
I want to say that I think I'm just so pleased to see that the Dental Task Force, which hasn't even been going for 2 years, has brought together the right people to actually, you know, we hear lots of things where people set out their priorities, these are the things they want to achieve, but one by one the Dental Task Force is achieving those things, and we know how important it is that people have access to dental care. Comes up every time I go knocking on doors, dentistry still. So I want to, and I also think it's something about Plymouth and about the way that we work with our partners. I know we say it all the time, but it really is true. People just work together to make things happen. And the news today is just so brilliant, and it is going to make a real difference to people's lives. And I wanted to add something that I hadn't quite clicked about the number of teeth that were taken out every year in children under general anaesthetic. 4,000 teeth, 600 children. And I did ask somebody the other day, why is that figure so stubborn? And I hadn't clicked that it's not about the figure being stubborn. That's the capacity for doing that every year. So we know there are more children out there that could be having their teeth removed in that way, but that is the capacity for doing it. So that's quite sobering. So what we need to do is to see that start to come down. But I just want to congratulate everybody, you know, that's worked so hard. And that task force has really shown that when you prioritise things and everybody puts their kind of shoulder to it, we really can achieve things. It's going to be brilliant for so many people in Plymouth.
Thank you, Jemima. I think what the task force, as you say, has been going, 18, 19 months, something, and I had hoped that we would get further down the line so we'd be able to dissolve that task force. But I think as we've got some of those things that we've achieved already, there's still that list of people who haven't got an NHS dentist. We still need to think about, some of them might well be able to pay if they have the stabilisation work done on their teeth first, rather than ending up with huge bills. So I think that it's going to evolve now, but certainly I think we're not unique. I think this is nationwide. Having said that, I seem to remember Councillor Creswell saying that when she went to visit her daughter in London, there was certainly dental practice up there saying NHS vacancies, blah, blah, blah. So I think it is geographic in some respects down here. So again, it's working on how do we get our students to stay? How do we increase those, I don't know whether you call them teaching dentists, that they have, because they have to do a year after they've qualified, they have to do a year in a practice. How do we increase those numbers that take those? So I think there's always going to be work, but yes, it's slowly but surely, but we won't give up. And I think, as you say, the support from the MPs has really made a difference as well. And that's all three of them. They've all worked hard. So it's been great to see that unity. Anybody else wish to come in on this? Rob?
Yeah, thanks for that, Rob. I've got a particular interest, having recently been looking through the archive of Improving Lives Plymouth, that I think we delivered some of the first publicly available dentistry services in the city back in the 1920s. And, yeah, I have really interesting evenings, as you can tell. But the organisation's got a long archive. But in terms of student dentist placements, I know we have quite significant numbers come through to ILP in terms of but I'm just thinking more broadly across the wellbeing hubs and the opportunities. I don't know whether we've been actively involved or some of the wellbeing hubs have been involved in the task force, but certainly all that the training for oral hygiene champions and the ability for the family hubs as well, looking obviously with children, whether there's more opportunity to integrate some innovation around or create greater awareness and knowledge around the Wellbeing Hub Advisor staff, and the ability maybe to develop some low cost on the ground immediate services that would dovetail nicely with this.
Yeah, so I mean, just to pick up on that, again, I think we are hugely fortunate in Plymouth that we've got a dental school. And PDSE, Peninsula Dental Social Enterprise, the teaching arm of that, they have got a dental outreach team. Again, we're hugely fortunate that they've got a dental outreach team. And I know that they do go out to the family hubs. They do support also the health and wellbeing hubs in the city, and they've also been instrumental in supporting the recently established hygiene hub in the city. They also they also give supplies to the food banks in the city as well. You know, people often think of food banks as just being food, but you know, PDSE also donate toothbrush and toothpaste packs to the food banks in the city. So I think we're incredibly lucky that we've got that dental outreach team in the city. And I am aware, and I put a few notes in the report about the sorts of organisations that the students go out to as part of their interprofessional engagement programme as well. So, I mean, you know, the breadth of organisations that they visit is huge.
Thanks, and certainly again, going back to Zoe and her report in a minute, there's some lovely photographs of the dental students that have been out to various of the hubs, definitely. So that's something to be worked on. Emma.
Yeah, I just wanted to say something about the experience, what that feels like for children. I actually, when I was a child, had 6 adult teeth removed under general anaesthetic, not because of decay, but because they were too big for my jaw. Nobody who knows me will believe that, really, but there we go. And I remember being about age 7 or 8 and waking up from a general anaesthetic to these great big gaps in your jaw. It's a very frightening experience, even, you know, under sort of planned circumstances. And there's something about children going through that unnecessarily that just is horrendous, isn't it? Speaking from personal experience, you don't get them back. So, yeah, really important.
Really quickly, just thinking about secondary school, do you have any plans to like go into secondary schools, or is there any thought about secondary school teeth and preventions?
I suppose, I mean, most of the initiatives that we've got, you are right, it's in those sort of formative years, if you like, when you're trying to establish patterns within the family that can then carry on through. I'm not aware of a huge amount that goes on in secondary schools at the moment. I mean, again, I could speak to colleagues in the dental outreach team at the dental school about that, but I think where we've sort of tended to, or where they have tended to focus, is almost going from first dental steps, if you like, right through the primary school, so that you set good patterns that will hopefully be in place then for children children and young people once they get their permanent teeth. So I don't know the answer to that question, but I can find out whether there is, you know, specific work going on in secondary schools.
Yeah, so it's just like a behavioural observation that sometimes children like go through patterns 8, 9, 10 are often the times when you think that they're independently doing their teeth brushing and perhaps they're not. But I just wonder if there's a second chance at that when they hit like 12, 13, 14, when they suddenly become conscious of
I think the work that they're doing, starting off with the primary school and then carrying on till 16, that will slowly but surely work through the years. And I think that to me is the good behaviour, shall we say. But I had wondered whether, in fact, if we're looking at the breakfast clubs that will be launched later on this year, whether in fact that will be, we will encourage more primary schools to engage with that, because after a child's eaten a breakfast, then that's the ideal time to brush their teeth, isn't it? But it's making sure that the schools engage with that, because obviously trying to get a class of 20 odd, let's say 5-year-olds to clean their teeth, I'm glad I didn't become a teacher, quite honestly, because I think that, you know, so I think there's going to be implications for that, isn't there, within the breakfast club things. So yeah. Michelle.
Just a few points. It's great, isn't it? It just shows what a movement can do within the city. But I suppose I'm just sat here thinking about other services as well. And you talked about the time it takes and the fact there's a general anaesthetic. But, you know, there's something about Thrive, isn't there, about weight management, about what they eat, about the sugar intake. What's the impact on speech and language? Because we've got big demand for speech and language. What's the impact on someone's mental health and well-being, self-esteem if they don't have teeth in their mouths? So I think that, so there's that bigger bit. And then the other piece that I was thinking about, workforce planning. So it would be really, really good to get that information, to know how many gaps, excuse the pun, around dentists we've got in Plymouth, because is there something we could do as a city, and whether it meant that we had the ability to sponsor so many dental students per year. If it's one, if it's two, you know, that could, you could sort of have, I don't like the term golden handcuffs, but it's sort of like, if someone, if you know, if you sponsor someone to train here, you know, about the impact that will have on the city, you know, make the most of having that dental school in the city. Just a thought.
Rob, can we add that to the agenda for next week, please? That would be quite useful.
Yeah.
That would be very useful. Thank you for that thought.
Can I just come back on a couple of those things? You're absolutely right about the impacts, and one of the reasons we were able to get Plymouth's Child Poverty Working Group, we were able to get them to focus on oral health improvement by telling them exactly the things that you've said now about the self-esteem, the ability to talk, the ability to eat, and all of those things, because a lot of people didn't necessarily see the links between child poverty and bad teeth. But you know, there's a whole list, as you've outlined, there's a whole list of reasons why there is a link between those things, and that was what we were able to do, and that's why we've been able to keep oral health improvement on Plymouth City Council's child poverty agenda for so long. Again, one of the things that springs to mind with your Live Well community dental service, you know, we're often told that if people aren't registered with an NHS dentist, we've got a dental access centre in the city, which we have, and it's brilliant that we've got that. But you can only deal with about 20% of the phone calls of people who are in real pain and desperate need, who phone every day. So there's 80% of the other 80% of the people have to try and ring the next day, or the next day, or the next day, or the next day, because they can't be seen. In terms of the gaps in dentists in the city, then that's one that really sits with the ICB, but we can pick that up and mention that at the dental task force next week as something that's come out of the Health and Wellbeing Board. A Health and Wellbeing Board today. I'm assuming you don't want to pick that up immediately now, Chris, with an answer, but we can. If not, we can refer it to the. You know, we can mention it at next week's meeting.
Yeah, please, if possible. So Melissa, who's the commissioning lead, unfortunately is away, so we've had to send apologies today, but I'll drop her a message as well to let her know that's going to be covered. I think there is, and I know that's this kind of a step on, isn't there? There is the national programme that we're supporting in terms of Golden Hellos, and I know there's been some success into Devon, and that's an offer that's still there. But yeah, absolutely.
And just again, if I can, just to make the board aware that the ICB does produce a stakeholder briefing on a quarterly basis. So it's probably something that this group of people might want to see if you haven't. It's put in the public domain, but it's just you may not see it amongst all the other things that you get across your desks. So it might be something that perhaps democratic support could make sure is circulated if you have access to it.
Thanks very much. I'm going to move on now. I made a slight error at the last. I should have been asking you to do some things after that Thrive it's the board asked from the Thrive thing. The board members asked to support the recommendations and reiterate their and their organisation's support for the Thrive Plymouth. Are you all happy with that? Yeah. And then the other thing to say is that the Director of Public Health to pursue academic offers from the University of Plymouth in relation to the effectiveness of weight management interventions. So we will take that forward. Okay, thank you. Are you all happy with that? Yep, great stuff. Thank you. And then going back to the dental ones now, so the Health and Wellbeing Board members note the content of the report and continue to work together to support the corporate plan priority of working with the NHS to provide better access to health care and dentistry. You're all happy with that recommendation? And what we will do is after next week's dental task force meeting is to do a general update. I did promise my council colleagues at council on Monday that there would be an update following that, so we'll make sure it's shared as well for you. Thank you very much. Right, so Andy, you can come and sit at the table. We'll let you do that if you want, or are you happy in the corner, whichever. Right, Zoe. Zoe, the floor is yours. Thank you very much indeed for coming along and for the all the information that you've sent us with your reports. Very informative. The floor is yours. No, I know it's no, Andy. You're the next one, but I just thought you would at least be around the table rather than you're the next agenda. Not Zoe's first. She beats you to it.
Thank you. So I have sent you some reports and I thought I would just take a bit of time to highlight some of the things from the report to bring them to life a little bit. So I'm going to talk about the Community Empowerment Programme and include some of the Wellbeing Hubs work, and Rob's here from ILP who also chairs the Wellbeing Hub Steering Group, so he can chip in with anything I miss out or want to clarify. So just to take you back to what community empowerment was all about. So it was set out by the Council and Cabinet report in 2018, and it was really about how do we change the way that we're working with communities. So really, if we think about it from a health and wellbeing perspective, it's changing the narrative from what's wrong with you to what matters to you. So it's really about having that kind of asset-based abundance mindset. So we are able to find solutions ourselves. We know what's important to us and the direction that we want to go into. And then it's moving also from an approach of aid. We come and, support in crisis to agency and giving people agency over their lives. So it's very much about partnership working. We've been talking about this afternoon. Very much working with voluntary and community sector, local community groups and associations. It's targeted funding to populations who are historically underinvested. That's geographically, but also some of people with particular health conditions or characteristics. It's about building capacity for community approaches to take action on the health and social determinants of health, so that broader upstream interventions we've mentioned today. And it's very much about reducing health inequalities in the longer term impact, and that pressure on primary and social care. So it's not an immediate outcome we're going to see, this is long-term, deep work. And if you look at some of the outcomes that were developed through a kind of logic model, collaborative logic model approach, this is trying to demonstrate the impact is about how do people belong? Do people feel they belong in their community? Do they have good connections? Are they willing to share skills and knowledge through things like volunteering? Are they aware of what's going on, the resources in their community? And are we actually reaching the population, the target people that we want to? Does that lead to improved sense of community pride? Does that support resilience? and does that improve mental health and well-being for people in the longer term? So we have an overarching programme that was set out, and there's 5 key themes. So one is around engagement, and that's very much around how does the council engage? How do we do that effectively, consistently, and to a good quality? There's one around enabling community resilience, and I'm going to touch a little bit on that because that's predominantly funded through either the local care partnership funding through the ICB and match funding that we get through different grants. Empowerment through the VCSE sectors, so that's very much about how do we work. There's a lot of co-production initiatives happening at the moment, a better understanding around that. That's around how we work with our wellbeing and family networks, and how we work pointing at Karen, representing Plymouth Octopus Project, but how do we work with our grassroots and VCS organisations collaboratively? Volunteering is the 4th theme, so we have a volunteer programme, which I'm going to touch on. So that's a PCC volunteer programme, but that's also broadly how do we work together as organisations across the city to provide high quality volunteering opportunities. And then there's something around leadership and cultural change. So in terms of the council, what do we mean when we're talking about community empowerment? How do we ensure that we are demonstrating as an anchor organisation in the city good practice across community empowerment? And how do we support other organisations to do that? And that includes things like recruitment and retention. It includes things like procurement as much as it does actually going out and engaging communities on the ground. So I've just put the high level budget there. So the budget comes from the NHS, through public health grant, adult social care, and a small amount through the Changing Futures programme, DLUC and NCLF funded. So there is no cost to the council for this programme. So I'm going to touch on community builders, which feature in the report. They're a big part of the programme. So we have 13 across the city. They've been community builders have been in post for around 2 years now. It takes a lot of time to build trust in those communities. So there's 6 communities of geography focused on areas of more socially deprived, but also where we identified in the city survey that people felt less of a sense of belonging. And then also communities of identity. So they take an asset-based approach. So they are out in the community. They're from members of they're members of that community where they live, and they are present in the community. And they're there again having asset-based conversations. They take a trauma-informed approach, and they listen to people in many different venues. They're out and about all the time. So over that period, we've had 1,700 listening conversations. And I think the difference is that it's not about listening to give somebody necessarily a service, but it's about listening and open questions around that person's life, understanding what that person's life is like and supporting them to take the steps that they feel they need to do. They've also then supported, with that in mind, 791 residents to actually lead their own community-based activities. So it's really about what can you do for your community, what do you want to get involved in? And I think if you look at the wheel on the right there, that's come out of the university's evaluation of the programme of the last 2 years. And if you think about in those bubbles, all of those things that a community builder does, they're actually very skilled people. It's a really hard job, I think, with a really broad remit. But they are a catalyst. So they really ask those right questions and give people that time to enable them to see opportunities. We talked about some of the initiatives around All Health Champions, and so they've been trained in a lot of different approaches and strategic offer, if you like, that the city has, so they're able to offer that when they go out into the community. When they hear, you know, those things that people are talking about, they're able to signpost them or provide them with that advice or support to actually access some of those initiatives. So they really are a bridge into other people, other connections, other organisations and services that we offer. Alongside that, we're also promoting a wider asset-based approach. So we've trained 90 people working across different organisations in the city in asset-based community development, and we run a quarterly kind of community of practice where we bring those people together to share learning and think about how can we embed this consistently across the city. the bottom of my presentation has fallen off. That's very annoying. But there is a nice quote there from the university's evaluation, talking about how the programme is actually achieving those aims of reduced isolation, increased friendships, and that kind of sense of connection with your local community, which we know impacts on your health. So financial insecurity is obviously a big part. If you're living of health, and if you're living in poverty, it's really hard to be healthy. So one of the programmes that we run through Citizens Advice is an outreach session, an outreach programme. And again, community builders have really supported finding appropriate outreach locations for Citizens Advice to attend, and then bringing the people along to attend those sessions. So in the first 2 quarters of this year, Citizens Advice have supported 300 clients in those, and you can, if you look at the map, the darker colour of green shows where the majority of the clients have come from. Most of the clients have a long-term health condition or a disability, and through those conversations that they've had with people, those sessions, they identify a number of issues. It might be debt, it might be housing issues, it might be a whole range of things. So they work through with people where the opportunities are, and through identifying additional benefits that people can gain, there's an 1,600 average income gain for those that cohort. Something else we've been able to do through the use of the LIFT database, which is the Low Income Families Tracker that we've brought into, has meant that we've been able to identify particular households to target, to provide support. So due to the pension credit changes, we particularly focused on pensioners during the autumn. So we were able to send individual letters out to people we knew were eligible for pension credit but weren't claiming, as identified through the LIFT database. We sent them a letter telling them they could apply online. We also told them that they would get a call from their CAB, so be ready for a call. So they weren't so worried about scams. And we also included in that letter a list of the outreach sessions and a leaflet on wellbeing hubs. And that's been one of the most successful programmes that we've run with Citizens Advice in terms of the numbers that we've reached. So people of that age certainly really use that letter, and it's had a big impact. So what we want to do using, we also are working with PEC, Plymouth Energy Community, because we've been able to overlay that data with information around people who are living in homes at risk of cold and damp. So we've also sent letters to them because PEC have received some household support fund. So in those letters we have said, you are eligible for some household support fund. PEC will be calling you to have a discussion about this. So it's a flavour of that one. So I mentioned volunteering. As we know, volunteering is as beneficial for the volunteer as much as it is for the organisations and people they volunteer for. So specifically funded through Adult Social Care as our Good Neighbour Volunteer scheme that came out of COVID. So we have one full-time member of staff who coordinates 35 volunteers who do 40 visits per week to people who can't get out of their house for whatever reason. They provide them yes, they might pick up prescriptions and shopping, but actually it's very much a befriending service as well. So we do get referrals from University Hospital Plymouth, from people who've just been recently discharged, and organisations like Red Cross as well. There's a nice quote down there at the bottom, which from Gail, who's one of our volunteers, who shops for an elderly couple. And she's a volunteer, but that's played a big role in restoring her own confidence after being affected by COVID. So again, it's as much for volunteers building skills and confidence as the people they support. Touched on digital, Michelle, earlier. So we are through the Changing Futures programme. We've trained up 15 digital community volunteers who have come through the Changing Futures programme, and they have been doing sessions in libraries and then moving into wellbeing hubs, just to provide drop-in support for people who might want really basic digital skills. And that also reminds me that our community builder also linked up with the GP surgery and brought 300 people to a session to support them to use the NHS digital app. So there's some really nice, links in this whole kind of ecosystem of how people are working together. Neil and my team also supports, we've got 666, slightly scary number, volunteers who actually volunteer for the council and council initiatives, which I think is really interesting and great on a variety of initiatives. And we also support, again, a kind of community of practice. So we bring volunteer coordinators across the city together to learn. And we've created a number of resources, again, to ensure that people have the right training and kit to give volunteers the best support and that they can get, so they could have a good experience. Food security, as we know, cost of living crisis, that's a big issue, not just in terms of affordability, but again, all the impact that healthy food can give in terms of your quality of life. So part of the food security project, we had some match funding from UK Share Prosperity Fund, and through that, over the last year, we've been able to set up 6 co-ops. And again, co-ops are local people coming together. They run the co-ops themselves. They make their own decisions about what they buy and how the money is spent. So it's very much democratically led. And so we've got 180 members across the city in more deprived areas, some of them based in wellbeing hubs and other community venues. We've also set up a social supermarket which can take more members, so that's at 4 Greens Wellbeing Hub. We have a second one opening in Milford's Trust in Stonehouse in March. So we've done a survey, or I say we, the royal we. Kelly, who's our coordinator, has done a survey on the members. 100% of them say they save £10 or more on a weekly basis. 89% eat more fruit and veg. 84% feel good about the part they play in the community. So alongside that, we have food cookery classes that we offer. So they run in a number of venues with a number of different organisations. But again, we try and link up with food co-ops and the social supermarkets, because strange looking vegetables sometimes arrive, and what do we do with them? So it's very much tied into, well, actually, let's learn how to cook. And again, it's about cooking together and eating together and building those relationships as much as it is just going and getting some food. So that's a really important part of the offer. And associated with that has been training on budgeting, on how to be a chair of a meeting and things like that. So again, a whole broad range benefits that people can have. And again, quote at the bottom is Phil, our food co-op delivery driver, is a great member of the team. All members like him. He was a volunteer looking to get back into paid work when we met. So Phil now is employed as the driver who can drop off the food to the food co-ops at 4 Greens. And then we also support a number of different member organisations, particularly around who are linked to food and food crisis through the Plymouth Food Access Network. So again, looking strategically across the city, working with Food Plymouth and other organisations to ensure we're addressing, we're moving kind of from food aid to food agency across the city. Okay, so I'm going to move on to the Wellbeing Hub Network. So again, you're probably all aware of the Wellbeing Hubs. The vision that was set out in the Wellbeing Commissioning Framework, Strategic Commissioning Framework, back in, I think, also 2018-ish, was about delivering a network of integrated resources to enable and support people in the local community to live independently and make life choices that will improve their health and well-being. So that's about equitable access to health and well-being resources, improving communities' experience of health and care systems, improving health and well-being through integrated community-focused services, and building a greater sense of community. So on the map, you can see there are, I'm just going to check the number there, 4, 5, 6, 7, 8, 9, 11 wellbeing hubs, make sure I've got it right. And there's a really nice geographic spread across the city with some gaps. And I think Rob will agree with me that whilst the first wellbeing hubs were set up in 2018, over the last 18 months, they've pretty much doubled in size. So that's along with the strategy that we had. We'd identified some particular areas, geographic areas where we wanted to have wellbeing hubs. And as you probably know, they're all run by different VCSE organisations at different stages of their development, and they are in very different buildings. So, you know, they're very unique, and they're very much responding to the local need in their community. They're supported by the strategic vision that's set out in the strategic commissioning framework. They're really about tackling health inequalities at that neighbourhood level. They are aimed to provide for the most vulnerable and underserved communities in Plymouth, and providing a space, safe space where people can go to that they can walk to, so there's no travel barriers. They also provide onward referrals and provide a space for different services to be in, so that we've got that integrated ecosystem again. And it's very much also about responding to the need as it's identified and as it changes, not just the most vulnerable, but beyond that, in that health prevention approach, upstream approach. And it's very much about building and holding relationships with residents. So again, a lot of volunteers come from the local areas to support those organisations to deliver those services, all run by the VCSE. And I think I put in the report, for every £1 that the Community Empowerment Programme invests through the ICB, there's £20 back in the form of additional services. And I have to say, that's a really rough figure, and I suspect it's actually a lot more, and that's something we want to do in a little bit more detail as we go on. And then in terms of governance, it's very much an alliance, so it's a network working together, investing a lot of additional time in, I would say, through those organisations to make that network work. The network does focus on delivery of NHS priorities as well, so that's primary prevention and secondary prevention through advice, education, support, promoting those positive lifestyle changes, but it's also about having organisations like Live Well South West come in and deliver services from those buildings. So that's about, again, the core 20 plus and the clinical areas of focus as well. So just showing you actually how we also relate to NHS as well as those wider social determinants. So it's very much about partnerships, co-production and co-location. So that's with secondary care, primary care, with housing, health and social care, and with social, economic and community organisations. How do we do that? Well, there are referrals. So GPs can make referrals, Live Well can make referrals, VCSE can make referrals, but it's also very much about having a walk-in offer. So you don't have to come to a wellbeing hub because you need a particular service. You can come because it's a warm, welcome space. You can get a cup of tea and have a chat. So we ensure through that network that the minimum criteria is that they're open 37 hours a week and have that meet and greet, you know, open doors, no wrong door offer to people who come in. And the core functions that we require under that are advice and information, social action and capacity building, wellbeing service, and some other related services there that I won't go through the whole list, but it's in the pack. So just to give you a flavour of numbers, quantitative data. So over that network well, actually it's 9 hubs with 2 more due to open next financial year. We've got 160 on-site services, 140 drop-in services, and then over 1,700 people attending off-site services, and that's this year. 50,000 contacts per quarter. So contacts, that might mean somebody coming back more than once, but that's a good thing. We're not trying to get people in and out, we're trying to get people to develop a sense of community. 7,000 people new to the hubs between October and December last year. 20% access to return, 250 staff employed, so you know throughout that network, and 200 volunteers offering 3,000 hours per quarter. And there's the match funding figure that I gave you earlier. So just a couple of case studies, because it does bring it to life a little bit. So this is P, who came in for long-term health conditions support. Not P, she's P or T, anyway, it doesn't matter. But she was living... PT. Living with multiple sclerosis for over 5 years and was referred to Manamede Hub by her GP. Through that conversation that she had with the Wellbeing advisor, she revealed that she was really wanted to build her self-confidence and optimism about her future, and she felt that she'd lost the ability to be useful and wanted to change things. She was ready to make a change. So she registered and attended long-term health conditions workshop. And you can see she was already nervous about doing that. And then she was, oh, shall I cancel? I'm not sure. She was anxious, but was persuaded to continue and attended the remaining sessions for the rest of the month. The tutor saw her confidence grow, started to share her own life experiences, and really benefited from understanding others' life experience, going through the same things. And now is a member of the follow-on group, attended Time Bank Southwest, and she signed up to actually be a volunteer to help other people. So again, you can see the ripple effect of coming along to the Wellbeing Hub and participating. So her quote, "Thank you for the course. It's met my expectations. I feel more confident about dealing with my problems. It helped me to meet other people with similar problems and realise I'm not alone." And the benefit of that is that hopefully that will prevent her having to go back to hospital in the long term. Another case study, LL. This was a single mum who came to volunteer with Four Greens Wellbeing Hub Food Bank. Again, was suffering from quite low esteem, and at the beginning she was questioning everything. She didn't really want to make a mistake, so was really quite nervous about participating as a volunteer. Over a bit of time, she was introduced to another organisation, Trevi Women, to do a course to build skills and confidence to access employment. Through that, she created new friendships. She then started to open up about her challenges being a mum and some of the challenging behaviour of her son, which is why she didn't want to go out with him. She was then encouraged to come along to a family cooking session to bring her son. And through that process, we've seen the relationship improve. And she was also applied for a part-time position within the social supermarket. So she's now got employment through that, started to feel valued and part of the team. She's gained new qualifications. So again, you can see the journey of that relationship through the Wellbeing Hubs. Her quote, "I didn't realise that organisations such as Four Greens could provide the level of support that they do." So just to finish, next steps for the Wellbeing Network. As I said, we've got two new hubs opening. And I think the main thing is, okay, let's consolidate now. So how do we develop the network, ensure that we are resourcing, prioritising the work as part of the ICB and the LCP? How do we work more strategically with partners like Live Well, for example, to support this community-based health ecosystem? We can see again, we talked a lot about collaboration. How do we best use those relationships? How do we best use those built assets? How do we link with the community builders to ensure we've got that neighbourhood approach? How do we raise visibility of the network to deliver health prevention? So I think we've got a real opportunity now with a focus on place-based working and neighbourhood working to actually raise the value of what the network are doing and ensure the adequate resourcing of it. We're looking very much at the new family hub centres as well, so improved collaboration, connection with what they're doing. And the hubs also have particular specialisms that they've developed over the years. And actually, how do we build those, and how do we support the bigger, more established and experienced wellbeing hubs to support the newer hubs to actually develop those specialisms and those connections across the network. So I think that's it for me. Thank you.
Thank you very much. Chris, you're online there. Did you want to come in and say anything?
Thanks, and sorry I was slightly late. We had technical problems with me joining the meeting. I think for me, what is really important is thinking about the work that we're doing through this programme to reach the people who are probably furthest from all of our services and for whom interventions can make the biggest impacts, and actually when they do access our services mean that we're able to support them better and give them better long-term outcomes. And I think that is really important. The ripple effect that Zoe's just been talking about, of people realizing that their lives can be impacted and how they can then impact other lives, shows that a long-term investment in that approach using trauma-informed and appreciative inquiry is really beginning to make a difference. And I think that's really, really positive. So, I'm really committed to the approaches we're taking, that are approaches around people, that are very people-centred, but can have real long-term impacts. And we all know people don't access primary care until it's crisis. And quite often there's all sorts of things that interventions at low level can make that big difference. That means it isn't making big demands on GPs and hospitals, because issues of loneliness and cold, mold, damp and things can be dealt with in other ways, and through the support. So the mix of community builders and wellbeing hubs and the development of family hubs is having, I think, a big impact. At the moment, it's more anecdata than data, and it's going to be difficult for us to pin down exact things. But I think this investment is really important, and that investment on a long term actually is going to help us transform lives and build capacity in communities so that people can do more to look after themselves, and do that as communities rather than just as individuals feeling isolated. So this has my full support, and as part of that, Zoe and Stephen will know, I meet very regularly with all the community builders, and we talk not just about the little bits of cases they're doing, but what does that mean for those big agendas about things like ageing well, or welcoming city, or building bridges to opportunity, where we're talking about how do we together tackle poverty, support community cohesion, and support people as they grow older, not just to feel that they're recipients, but they can still be active participants and fully supported, engaged, and not isolated. So real positives, I think, and there's some real inspirational stories coming out. So thanks, Chair, just for that opportunity to say a few words. I'm sure there were questions, and most of them I'm sure Zoe will pick up. I just wanted people to know this isn't just a little programme that's happening away. It's a big programme that's really important, I think, for all of our shared agendas. Thanks.
Thank you. Yes, it's been really interesting reading the papers that have come through, and opening all our eyes. I think, obviously, Rob, you know a fair bit about it anyway, but I think to the rest of us that know bits about it, it's pulled it in. I've got the Vice Chair who wanted to ask a question first, then I'll open it up to everybody else.
Yes, I'm a councillor in Plymouth, Radford, and sadly there's no wellbeing hubs at all east of Nairn Bridge. We've got a growing population. We've got Saltram Meadow, Sherford, and I feel that we're a bit deprived by not having something there. Could you let me know if there's any possibility for anything happening in that area in the future, please?
I think Steve might want to contribute to this, but I know that Plymouth wasn't identified in the original vision for an area for wellbeing hubs. There was a meeting in the summer bringing together some organisations to identify what the gaps were and what the opportunities might be in terms of Plymouth. I would say that the community builders, those who have communities of identity, particularly who aren't restricted, if you like, to a geographic area. So, for example, Mel, who's the one for older persons, I know that they are working across the city, so there is some work going on in that area and some support. There is a little bit of a hub, if you like, by the library, where you've got Age UK, you've got library services, and you've got community centre there. So we've been doing some, I know we've been doing some green permaculture and green engagement at the community centre as well. And I think through the lift work, we also identified residents. We were able to send letters to residents who we knew were living in the Plymouth area as well. So I agree there is not as much going on in Plymouth, and I understand your concerns.
Let me just say, with the new bus service that will be coming online in March, at least they'll be able to get on the bus from Plymstock and go over to the Plimpton one. So there's always that we can make sure that that's advertised. Rob, you wanted to come in.
Yeah, just on Plymstock, just to, excuse me, just to say there are quite a few services that an ILP and Wolseley Trust actually deliver in the area, and we worked very hard with Maurice Watts, who was one of the strategic partnership leads at Livewell over the last 18 months, because he was very keen to establish some form of wellbeing hub. We were working with the local GP's practice, with the practice manager, and we were looking all around the Broadway and all that area around. Could we find a physical building where we could run on a temporary or a trial basis a pop-up wellbeing hub? Because we do have staff who are working out in Plymstock. There's a community builder, just to try to see if we can develop something from the ground up. But we weren't able to identify any suitable property without significant funds to develop a wellbeing hub. But it is an area of geographic interest to us in terms of development.
Laura, do you want to come in?
Yes, please. I spend a lot of time in the university looking at the big NHS agenda, and it strikes me that you're achieving 2 of the 3 main shifts that the NHS are talking about in their reshaping and their planning. So the move from treatment to prevention and the move from hospital to community. Is that on purpose, or does it happen to be that you guys are just way ahead? It seems to me, if you've got the measurement, and if you're not quite ready to have the measurement done because you haven't quite had time to get the data, it seems to me you're demonstrating how it actually can look, which is a problem a lot of us are having, which, imagining what does treatment to prevention look like, and it seems to me you're showcasing it.
So I think I've been in post for 6 months, so I can't take any credit for the development of the programme. It's a public health initiative with support from the NHS, I would say, and I do think it was a strategic initiative with foresight, in my opinion.
Chris, do you want to come back in here on that?
Thanks. I think of the team working on it, I'm probably the person who has been around the longest, and this goes back to actually during COVID, when the council established the team that Zoe now leads as part of tackling COVID, but also as we looked at the COVID recovery and learning lessons, realising that some of the things we were doing and some of the things that we could progress would make a very big difference in terms of prevention, in terms of helping people access the right services at the right times. And I guess that we were trying to feed those learning points through the networks we had as we've gone on. And those networks, for me as a politician, have included the COP Council's Innovation Network, the LGA, and of course both the Labour and Conservative parties, of which I'm a member. And so maybe we've helped to inform some of the current policy thinking because we were starting to do things. And that's not playing party politics. I think every politician does it. But we've been using a lot of mechanisms to do that, to talk about our learning. And during COVID, we got funding from COP Council's Innovation Network to get some mobile phones to actually just begin to experiment on what it would look like if we were able to communicate with people without them having cost, to reduce isolation and help them to fix into networks. So I think we'll claim some credit for forethought, but I'll also think we'll claim credit for the fact that Plymouth is really good at being innovative and to be looking at how we as a system tackle some of the problems. And government often lags behind local government and local innovation. So, I think it has been positive, but it was purposeful because we as a system, and that sounds horrible, actually really are people focused, and we want people to be in their homes, in their communities, being active, being well, actually being part. And I remember years ago, I was led the secretariat for the Commission on the Future of Volunteering, and Baroness Neuberger talked a lot about reciprocity. And it wasn't that you just received or you just gave, but you did both. And this whole programme is about doing both. And that is where we know through ripple effect, prevention is happening. And it's why it's quite hard to have data, and it's more about anecdata, because the story of Mrs. Miggins will be different from the story of Mrs. Khan in a different part of the community, in a different part of the city. And I think we need to just think through those implications, knowing that we need to create the data, but actually trying to keep people at the heart of what we do, because that's why this programme is being successful. And quite often government's very good at trying to take a successful programme that's run locally, put it into all sorts of boxes, make it a system, and it doesn't work because you haven't put those relationships in. And it's the relationships that we discovered were key to this through that work we did all that time ago. So I think that probably puts some of the background on that was the work that we developed in those early days of COVID with Ruth and Rachel.
Lovely, thanks, Chris, for bringing that to Jemima. If you wanted to come in.
Yeah, I was really interested in the bit of targeted work that you talked about around the HSF and using the lift data, and I take what Chris just said about data, but actually I didn't know if you were looking at other initiatives in that targeted way, using those networks and using lift or other data to target people around certain things, whether it's benefit entitlements or whatever, because that looked like a really impressive bit of work. So how you can do more of that, really going directly to people.
Yes. So it's quite new to us, Lift, and so it's a platform that PCC buys into. And so yeah, we have kind of working group with the Revs and Ben's team, with Community Connections, so that we can look at how we can use it with different cohorts. We also link into a national, people who are using it nationally, so kind of learning from what they've done. And I think one of the most challenging things has been around, GDPR. So we have in this initial pilot been able to do that through a sharing agreement with Citizens Advice and Plymouth Energy Community. But longer term, we might take a bit of time to look at how we do that across the board. But certainly there is an opportunity to identify families who may be at risk of crisis and be able to support them before then. So that's definitely something we want to go into next. And I think with the pension age cohort, we were certainly sure that a formal letter would be, they may be more likely to respond to that. But with families, for example, we've talked about, texts. And so, for example, Plymouth Community Homes regularly send texts to their tenants. So they are used to receiving text and they might not think it's a scam. So how, for example, can we work with PCH to actually target some of those residents that we know who might be falling into crisis soon, before that happens?
Even if, sorry, Chair, it's all right if I come back in. Sorry, given you
I'm just conscious of the time. So I've got Michelle waiting. Is there
just
something you
super
want to say quickly?
Just in terms of the point that you've made around identifying families who might be heading towards crisis and don't know about family hubs or the wellbeing hubs or any of it, and targeting them to invite them. Thank you.
Chair, could I just quickly on Lift?
Very quickly, Chris, because we're really running over time here.
Yeah.
All right.
Just very quickly, we've been using it to give us some of the data on free school meals where take-up isn't happening, just in case we didn't get auto-enrolment as a thing through council. The other bit we're doing is looking at other data sets. So we also have a data set called Parity, which we use in housing enforcement and housing improvements, which identifies housing with poor quality builds, with heat, mold, cold problems. And we're looking at how we cross-match, and we have been looking at how we cross-match Lift and Parity to identify households where we could do multi-agency work that deals with lots of the problems with a very targeted cohort around that. What we're looking at is what that would cost, because to do that intense work would mean not only interventions in benefits, but also interventions in a built environment. But we're looking at how we use these data, not just in terms of benefits, but also other data we hold on people's personal circumstances, and how those interrelate.
Thank you. Michelle, did you want to come in?
Only just really quickly to say that this is the beginning. You know, this is amazing, absolutely amazing, and you know, it's worked up over years and it's layered, and you can see it's real. So I think the question around the government policy from acute to community, I think this is, you know, allows more and more to happen, and it's a bit of a watch this space with what's going to happen, particularly around Ferty.
Yeah, great.
Thank you very much indeed. Right, so what I need to ask you to do is that you endorse the Council's approach to the delivery of the Community Empowerment Programme and the Wellbeing Hubs Network and the direction of travel proposed for 2025 set out in this document. Are you all happy with that, folks? Great stuff. Now, I am very conscious that you've been here now for a couple of hours, but I'm also very conscious that we've got guest speakers still here. Does anybody need 5-minute break, or are you happy to go on? And if you need to go and have a break, you wander off. Like, are you happy? Carry on? Right. Thank you, folks. Andy, welcome. Andy is the independent chair of the Adult Safeguarding Board, and we really wanted him to come along and just to update you as to what was happening. Andy had the job of doing an annual report, and we felt that we needed to hear what was progressing. So, Andy, the floor is yours.
Brilliant. Can I just check, Chair, timing-wise? How long would you like me to? Because
Well,
I could
I've
go
got
for a couple of
25
hours.
minutes down here
Yeah.
on my time, but you take what time you
Appreciate
need.
you may have overrun, but that's fine. I can do it in 25 minutes. Can always come back if it's not long enough, of course, at your discretion. Thank you very much for inviting me today. By way of a very brief introduction, Andy Bickley, Independent Chair of the Safeguarding Adults Board Partnership in Plymouth. A position I've had the privilege of holding for the last 10 years. By way of sort of introduction, quick background, I did a 30-year career in policing. So for the last 10 years, I've been in recovery from that, but also chaired various partnership boards in the city, formerly children, adults for that period of time. And I do a lot of consultancy safeguarding work for other organisations, safeguarding reviews, etc. So that's just a bit of my background for those that I've not met before. It is a great opportunity for me to come and present the report and to discuss it with you. It was published in 2024 and it covers the performance year, if you like, the reporting year to April 24. So we're slightly delayed in terms of timings. Very keen to kind of compress that down for next year. But very genuine reasons why we've not been able to come here prior to today. The purpose from my perspective as the independent chair is very much to share what we do, try and connect across the system. I think we're brilliant at operating in our silo, but I do recognise we need to come out and reach more across the city with stakeholders to say what we do, what we are, where we're progressing and where the challenges are. So it is about the connectivity, but also, and it's really important for me, that we're accountable. So the annual report is a mechanism of accountability. I think there is a challenge for how agencies use that, individual agencies use that, and I think they could do more to spend time, as you are today, on this report and the progress of adult safeguarding in the city. But I do see it very much as a mirror out in terms of that accountability for us as a partnership. The report does reflect a lot of hard work that's been done by the multi-agency partnership. It's a very broad partnership, very diverse partnership that works very well together, but not in a kind of passive way. It is at times, quite rightly, given the nature of what we're there to do, hold each other to account and challenge where we need to do that. And it does reflect a lot of work and a fantastic work of individuals that are aligned to the business area of safeguarding adults in the city. I've got some really good people that have been nationally recognised for their achievements over a long period of time in terms of national awards for their support for adult safeguarding. in the city. What I would say is it's not an operational group. So there's always this challenge and tension around how far we go into the operational lanes against the balcony view and the oversight role of the partnership. And it is very much around the oversight. How do we ensure that adults in the city safeguarding requirements, that they're being met, and they're being met to what kind of standard? But it is not an operational group. It's governed by the Care Act. I won't go through every element of the Care Act, but the Chapter 14 does set out 3 specific duties for the partnership, one of which is to publish an annual report which details what's been done during the last year to achieve its objectives and what partners have done to implement the strategic plan, which is part of the report. The annual report should also importantly set out the findings of safeguarding adult reviews. And there is a review which was published during the performance year in question, which is contained in the report. And what strikes me with those is the amount of crossover with other areas of work in the city. So if you were just to look at some of the recommendations from the CAFSAR that's in the report, a lot around violence against women and girls, domestic abuse, sexual violence, and how we then link that into other work in the city, the Think Family agenda, domestic homicide review learnings, how we can really coherently understand not just the single review, but what does that tell us about the connection with other areas of work in the city. So it is a duty to publish it, and we've progressively improved it, I think. So we have a digital version which is linked in your pack, which I know Elliot's kindly put up on the screen as well for me. I'm not going to go through, you'll be pleased to know, every single kind of section here. I am going to draw out some highlights and also present some challenges that the report contains. I'm going to focus, to start with, just on the priorities and structure. I'm then going to talk about the year in focus and some work that we do around assurance. I want to share with you some future plans and signpost to some work that we're doing that I think is going to make a difference to us. And I also want to end in terms of links to some of the data, and then open it clearly for questions that you may have. So just in terms of the priorities, if I could take you to that structure or that section. We operate around the 4 priorities, which is supported by a very comprehensive and fluid business plan, which is updated regularly, and it's an iterative process, because we do recognise when we start a year, we come across all sorts of initiatives, a lot of which Zoe spoke about, where we could hook in, and we need to be better understand and better aligned in terms of other agendas. So we focus around the 4 for every opportunity we have in terms of the subgroup works, which I'll talk about in a moment, as well as the partnership itself. So we are aligned to prevention. We are very much aligned to engagement, and I'm pleased to say that a lot of what Zoe was covering there has featured to some degree in partnership meetings over the last year to 18 months. So we've had a really good presentation from the 4 Greens Community Hub, from which then generated a lot of connections with partners sat around the Safeguarding Adult Partnership. That's not choreographed. I didn't know that was going to be covered today, but it's iterative. It shows the work that's ongoing, and it's not just something that's done in isolation. So prevention, engagement, assurance, and that's the kind of the conscience for me of the partnership is around the assurance. How do we assure ourselves that those quality standards, that the safeguarding needs of the adult community in Plymouth are being met? They're absolutely key, and I'll spend a little bit more time in a moment just explaining some of the things we do, and it's not perfect, but some of the things we do to try and secure that assurance with our work. And the 4th priority then, is in no particular order, but is learning. And I was really pleased that the LGA peer review that presented initially some early findings last week, I don't know if they've published yet, but the early indications were that they were very encouraged and positive about the deep learning culture that existed within the Safeguarding Adult Partnership and the work in the city that's done in that regard. So that was really good to hear. Always more to do, of course, not complacent. So those are the priorities, and then in terms of the structure, so there's another link there on the report which goes to the structure. And it just sets out, we're not hierarchical, we create groups where we need to create groups, task and finish, early learning kind of approaches. But we have the partnership which meets quarterly. That's supported by an executive group. The executive group does all the heavy lifting, all the papers, hundreds of pages of papers that need sign off. A lot of the dry governance is done by the executive group. That allows the partnership to have much more free-flowing strategic discussions and excuse me, considerations. And for every partnership meeting, every quarter, I try and bring in an operational presentation, somebody from the front line, a frontline worker, a frontline manager or supervisor from any agency doing anything in the city linked to adult safeguarding, so that the strategic decision makers get to hear and get the insight directly. So it's less paper, more plenary, more discussion, and more connectivity in that sense. We've got a standing group that looks at safeguarding adult reviews and the statutory requirements that we need to fulfil there. Clearly, that's a really tough area of work, but I've got some real specialist skills in there, great support. I appoint an executive lead for each SAR so that there is senior level accountability from the partnership in terms of that process. A real challenge around the SAR process is how do we know we've embedded the learning? You know, we'll do a report, we'll have an independent report, a really fantastic insight from an expert. But how do we know a year later that those recommendations have been enacted, and what was the impact? What was the outcome from those? So that's a constant kind of how do we do this? And I've started to bring report authors back in after a year to hold partners to account, to go through where they are with those recommendations. An assurance group that covers a lot of the business. It's really a business management, draws together the business plan, the various elements of the risk register and strategic discussions. That's my engine room. That's actually chaired by an independent vice chair. We're the only partnership, I think, in the country that's got two independent people as chair and vice chair of the partnership. And I think that's a real strength for us as a city to have that. The final group there on the chart is the participation and engagement group. I'm really pleased with the progress of that group and the connections that it's made, some of which I've mentioned earlier in terms of the wellbeing hubs. But across the city, we are beginning to get more of a footprint and more connected with communities to understand need. We did a lot of work during the National Adult Safeguarding Week in October last year with the Community Safety Partnership, joining various initiatives with them, which was really, really good. So that's progressing very well. So that's the priorities and our structure. I just want to now go to the our year and just focus on not what we did during the year necessarily, but the actual assurance framework that we utilise. So it's the our year section. That just breaks it down sort of per quarter in terms of where we focus. So I think it's a really good way of explaining the journey that we've been on during that reporting period. Towards the bottom of that is the PSAP assurance statement. So every year I want to come out with an assurance statement. I want some sense of certainty around and some sense of assurance around where we may be. And that's not a one-off thing that we do at the end of the year. We do it throughout the year to try and gather the information. So the business plan and the business plan updates contain a number of actions, and it's very clearly aligned to individuals, so we know who to go to for those updates. The partner self-assessment is really powerful, so we do run and try and improve that every year, asking partners to self-assess against a number of set questions about how they deliver, how they manage within those organisations. So it's more of a deep dive for individual agencies, the constituent parts, if you like, of the partnership. And that then comes back and is analysed. And we've got some of the analysis in the report, which I won't go through, but I think it gives a sense of confidence that we are asking those questions and we are looking at those areas where people feel strong or not so strong in terms of their delivery of the agenda. The safeguarding adult reviews, that's always a great opportunity for me culturally. We've got an expert from outside the area coming into the city to look at how agencies have worked or not worked well together. And that outside that outside individual is able to give us some insight into how we operate, whether we're closed, whether we're defensive, how difficult was it to get to, you know, the learning outcomes that needed to be secured. So that's just one example of how, you know, I'm always mindful of how we use that expertise to inform us, not in terms of just doing the report, but that environmental kind of scan. We do an annual system audit, so the performance in our data, we're data rich. I'm not sure we really understand and appreciate what the data tells us. I'll come on to that a little bit more in a moment before I end. But what the data does flag for us is areas where we would pick up a deep dive. So over the last couple of years, for example, we've noticed you know, high volume, not just in Plymouth, but nationally, around cases of self-neglect. And it's a high recorded category of adult abuse, probably the highest in the city. So we wanted to understand what were the hallmarks of that, what were the drivers of that, contextually what did that mean. So we used some of the budget allocation to commission a deep dive review on that issue, and then produced a number of recommendations. We've done the same around the referral rates for safeguarding, which is linked to the data, which I will speak about in a moment. Partner feedback is always really strong. We do individual interviews with those that are willing to, that have been through the safeguarding system. Living Options Devon have been supporting us through a commission contract to get some qualitative understanding of people's experiences and journey through the safeguarding system. So assurance is as I said, it's the jewel for me, it's the conscience of us. Everything else is really important, but we have to deliver effective assurance. And those are some of the mechanisms that we use to do that. I'm now just going to move to the future plans, and I just wanted to say here that there's a lot of detail in there. I'm not going to go through that. It's a little bit too sort of cut and paste, and note to self to improve it for presentation for next year. But what I did want to say is there's a few areas that I'm really focused on as we go forward. One is equality, diversity and inclusion. How easy is it for diverse members of our communities to navigate and access safeguarding systems, safeguarding services in the city? This isn't just about that category of discriminatory abuse. It is much deeper and much wider than that. And we have commissioned 2 independent reviewers to look at that for us. They are about to report, so that will feature in a subsequent annual report. But I'm really keen to understand how that fits. And I think we've got a lot to learn there. And that will be learning that will need to be shared with other partnerships as well. Data, we are very data rich, but that appreciation of the data and how we join the data up. I'm doing some work at the moment around domestic homicide reviews for the city. And I'm really struck by the fact that we tend to look at these findings, or children's safeguarding practice review findings, very much in isolation. So how can we put that together and really do some heavy lifting, analytical work to understand what the data is telling us. And for me, it's about how we use that data going forward to drive prevention. And again, you know, Zoe's mentioned prevention with a lot of the health and wellbeing. It's a common agenda across the city. How can we use it to really understand intersectionality, demographics, causation, context more? We've got to make the data really sweat, I think, more than we do at the moment. So I'm really passionate about how we take that forward. And the other go forward sort of future issue for me is about resourcing of the partnership. We do not have as a partnership a dedicated, fully paid business manager. It's a part of a post that's supported by Plymouth City Council. We're the only partnership in the country, I think, that doesn't have a full-time dedicated resource to support the work of the partnership. So that is work ongoing. Those that are on the partnership in the room will know that work is ongoing. We've had a peer review last year, which has kind of really supported, evidentially, the requirement for greater capacity to support the work going forward. We rely a lot on the goodwill of individuals at the moment, and that's not sustainable. And finally, if I can, Chair, just the data, and I think the data gives some sense of scale, as Zoe used before me, but for our data, the data section, just a couple of headline bits there if I can. So the first sort of bar diagram, 7,525 safeguarding referrals in this performance year, which is the most we've ever had. So that's a significant demand. In some ways, that could be a good thing. You know, we've done a lot of work with South West Ambulance Service Trust around their referral process. To be fair, the trusts have done an awful lot of work to improve their capacity resourcing and referral process. So I need to ensure that every agency is engaged and knows how to refer, but equally we need to make sure that you know, we put in the appropriate response. So just following those top three diagrams down, there's 7,525 referrals, safeguarding concerns identified in just over 1,000 of those. Only 469 went to a statutory safeguarding inquiry known as a Section 42. So that's a massive attritional rate. There's a lot of demand and work in there, but only 469 of those went to a Section 42 inquiry. Now, outside of that, all the others would have been triaged and managed and the risk mitigated through risk management or a Care Act care and support needs assessment. But I think it's just illustrative of the level of demand and then the work that's needed to support both statutory inquiries and other measures to mitigate safeguarding risks that might be prevalent. That really concludes what I wanted to say. I might have gone on a little bit longer, Mary, than I intended to. And I will also ensure case studies are very powerful. There's not many, if any, in this report, so I've just note to self again next year to get some case studies in terms of impact and outcome. Thank you very much.
Thank you very much indeed. And certainly sitting on PSAP, it's quite, it can be quite harrowing, but it's also how do we all work together? And I think that to me is what's important, and certainly the dedication of varying organisation is great. And the fact that the ambulance service have come into much more, haven't they, over this last 12 months? So that's always useful. I think what I need to do is, there's something in that about transition period I noticed from the report. There is that transition, and certainly in a minute when Siobhan gives her report, I think that's something that Jemima and I would be really, really interested in, because we're looking at sort of transition generally between our children and adults. So that would be good to know, and to look into that as well. Jemima, you wanted to ask something?
Yeah, I know we're going to move on to the children's report, but it's interesting, if that's the right word, that neglect came out as a theme for adult safeguarding and for children's safeguarding. So I just wanted to understand a bit more about how, if we have emerging themes from both areas, you talked a bit about working together, Andy, just how do we make that account? You know, that's quite worrying that that's, you know, spread across, you know, all age groups, that neglect is the issue that's really coming to the fore. I just wondered how the two groups work together when themes like that, matching themes as it were, if that's the right term, emerge.
Well, the two of you are here.
Yeah, I guess I'd go first with that. I think it's been a weakness for us until recently. And we've just begun to create space for the chairs of the respective groups, including Community Safety Partnership and business managers, to come together on a regular basis to share those kind of themes. So transitions has come up. The work has been done up in Teesside, Safeguarding Adults Board, around 2 SARS, where transitions are at the heart of it. We're bringing that back. We've spoken to David around the children's area, taking it to Transitions Board to work out what we do and who does what in terms of that. So I'm really encouraged by that. The other thing is, and it's quite a basic thing, but our agendas now reflect, as a standing agenda item for updates from every other partnership in the city on the Adults Partnership. We had it last week, so it's relatively new to do. And that's relying on the other partnerships feeding us the information that needs to come in, and us sharing back what we would like them to raise on our behalf. So there's a couple of examples there. There's something here, Jemima, around data and around how we join up that analytical lens across everything. That's the bit I haven't reconciled yet, but it's on my list, you know, of areas to take forward.
Did you just want to say something before you have the time in a minute?
I feel like I'm just going to copy what Andy has said, but yes, we have now got those better connections. We are now speaking between the three partnerships. We communicate prior to boards to make sure that we're all up to date with the area and position of each partnership so that we can get that better linked in. And we also have, I will probably come on to this anyway, but we also have a Safeguarding Adolescent working group where we have a representative from Safeguarding Adults as well within that group so that we can look at that transition space within that group as well.
Can I just ask one last thing? So if in terms of recommendations, if you're looking at a theme that is similar across partnerships, is there a way of having joint recommendations as opposed to being separate? I don't know. I'm now really focused on the neglect issue and just how recommendations could be across the board as opposed to each individual board. I don't know.
I would like to say we're fully coherent, but we're not. Part of my thinking is we need some kind of repository locally to bring those together, and then to get that single view around the analytical bit. But we haven't got that at the moment. Do we share? We do share our findings, but I don't then know what happens to them when they go to the different partnerships. And equally, domestic homicide review recommendations not widely shared with us.
Jemima, can we have a conversation outside of this room, I think, with David and with Gary, because both of them sit on the respective committees. So I think that would be really, really useful. So that, I think we'll put that down as a recommendation, even without hearing your report there, Siobhan. I think that we put that down. Anybody else got any questions, any queries? No? I mean, it's. I always find it fascinating when you have meetings with outside people coming in and giving their views on things, because it does help us to function much better and more efficiently. And certainly you mentioned about the awards. I mean, recently council were advised about Jane getting that lifetime award. She still hasn't actually physically got the award. We're still going to be able to embarrass her probably in March when we present it at council. The Lord Mayor presents it at council. So again, that will give us that opportunity to remember that safeguarding is everybody's business, and I think that's what's important. Andy, thank you for coming along for that. So I've got that we note the report, but I've also then got that extra one now to say that the cabinet members and the two senior management team people, as in Gary and David, will meet together to discuss how we take this forward about the transition period and how we share information. So if I sort of ask Elliot to try and make a sort of comment about that, but are you happy with that going forward? Okay, no dissenters. Thank you very much indeed. Which then brings us on to Siobhan. You're the Safeguarding Business Manager, so welcome, and you're going to tell us about your report.
Yes, thank you. I feel like my introduction could be a copy of Andy's introduction, but we just replaced Safeguarding Adults with Safeguarding Children. We also have a wonderful partnership full of representation from all over the city, all focused on safeguarding children. And the report that we're talking to today, again, it's the 23-24 report, so it takes you up to April 2024. And within that, you'll see how many different people have contributed to that report, purely by looking at the membership within that. The report reflects that in December 2023, there was an update to the national guidance of the Working Together to Safeguard Children. And so that update has made clearer expectations on partners around safeguarding children. And I won't repeat everything I've put within the papers you'll see today, there is obviously a summary of the annual report where you'll note those changes within working together, and how when that was first brought in, then us as a partnership, we've taken part in a health check with the Department for Education, and within that health check, then it was raised that we had some weaker areas that we needed to work on within our implementation of working together. And so some of those areas have been addressed within the report, and some of those are ongoing. And I believe I've got some slides, Elliot. Thank you. Or didn't know if I was sharing them already. It's sharing them. Let me see if mine works. I'll try and steal it from you. Oh, there we go. It's okay. How do I put this into show? Oh, I've forgotten how to use PowerPoint. That's a good start, really. That's why I can't see it. Sorry, everybody. There we go. My small team section was covering the bit I needed to press. So, obviously, yes, we've talked about that there's a more prescribed structure to the report because of the working together guidance. It's quite clear about what elements need to be within that report. So we have found that the report for last year was quite lengthy, and we are looking at ways this year to try and shorten that so that it's a more coherent document for people to read. It's highlighting those significant changes within the priority areas within the partnership as well. You'll see that our priority areas are neglect, safeguarding adolescents, child sexual abuse and domestic abuse and children. So within those areas, there has been a strategy, practice guidance and toolkit created for each area. That's for frontline practitioners, it's for families, it's available on our website, and it shows what we promise as a city that we're going to deliver within those areas, but also looks at the various toolkits and resources that are available for people within those priority areas to help assist with that work when you're a frontline practitioner. So those priorities are within our annual report. But again, because the annual report goes up to April 2024, then there is, you'll see that there's a cut-off, but I'll go on a bit later on to explain where we've gone from there. Within the report as well, we've highlighted our quality assurance and our embedding of a learning culture. We run 4 quality assurance audits as a minimum per year. They're multi-agency audits where we have representatives from all agencies come together to look at a group of around 10 to 12 children. Those children aren't specifically named within the audits. The agencies know which children they're looking at, but they're not named within the audit. It's for us to come and look at themes and trends within practice to make sure that you can see, as agencies in a partnership, where improvements need to be made in those areas and what learning we can use to develop as a partnership. All of those the learning from those quality assurance audits is then fed into our working groups around our priority areas. So for example, if an audit is looking at neglect, all of the actions from there and the learning is then fed into that working group where they then deliver on those learning outcomes to make sure it's a joined up approach to how we embed that learning. Obviously, I've talked about the health check already and how that's identified our areas of learning going into this year. What you would have seen within the annual report was the governance structure that looks slightly different to this, because the governance structure within 23-24 was different. So from 24-25, so this current year, this is our updated governance structure. So I thought it's really important that we show you this to see that we've streamlined some of those groups, and also to see where the working groups at the bottom here, the 4 purple ones next to each other from neglect to safeguarding adolescents, how they fit into that section to make sure that we're always putting those priorities first, and that work from those groups feeds up then into our multi-agency performance and quality assurance group, which then ultimately feeds into the Safeguarding Children Partnership Board, which is the larger red circle in the middle. You'll also see from the governance structure that we have delegated safeguarding partners and lead safeguarding partners sitting above the Safeguarding Children Partnership Board. Within Working Together 2023, that has stipulated whose responsibility it is to oversee all of the safeguarding within an area. And so our lead safeguarding partners are the Chief Executive of the local authority, the Chief Constable of the Police, and the Chief Executive of the Integrated Care Board. But within Plymouth, we've also lifted a fourth person into that space from education. So to make sure that we are keeping education at the heart of that lead group. And within our delegated safeguarding partner group, we've also got an education representative there. As Working Together, although it states that we need the 3 statutory, there is also room then to be able to lift education as that fourth partner, because they're absolutely paramount in safeguarding our children. And then if we just look along the yellow groups, those are our strategic groups, so our multi-agency safeguarding hub, looking at the referrals into that MASH function, and then the child safeguarding practice review group. So as Andy touched on, the domestic homicide reviews and the safeguarding adult reviews, we have child safeguarding practice reviews when there's a serious incident or death of a child, and where there is thought to be of some form of neglect or through the injury that's happened to the child. Within that group, again, we produce learning, and that learning is fed back into the quality assurance group and back into those working groups to make sure that we are always looking at that closing the loop activity, and is also fed back up into the partnership board, so that all of the learning that comes from these reviews is closely monitored to ensure that we're closing that loop activity so that we're having good outcomes for children. And you'll also see our strategic workforce development group. So you would have seen within the report, we have a training arm of our partnership, which offers training to multiple agencies within the city, with various courses available all on our website. And again, those courses are paramount to some of our agencies. It offers our level 3 safeguarding training to our Live Well colleagues, to our colleagues at the hospital, and then it offers to anybody that would like to come on those courses as well. There is a cost element to those courses for those that are not within our contributing partners. However, we're also currently creating level 1 and level 2 safeguarding training as well that will be free for people to access on our website. So where we are now and our future development. So I know that you've seen a copy of the report and the summary document, and I just wanted to highlight some of what we're doing now to make sure that you're aware post 2024, as we're nearly up to the sort of the creation period of our next report. So it'd be helpful for you to see what we're doing now. As you can see, we're going to continue to embed the learning of our quality assurance processes through those working groups. Our partnership chair is, I forgot to mention, is one of our delegated safeguarding partners, so that's David Haley as our partnership chair. And again, that's stated within Working Together that it must be one of those delegated partners as chair. And he's met with each of our working group chairs to help develop clear action plans for that work going forward. So, and they've all said they found that really, really helpful, that they've got that guidance of the expectations of the chair and also how they can implement that learning in a time efficient way. We've worked with Somerset, who are Department for Education leads in information sharing, to create a Tier 1 information sharing agreement that's now been agreed by all partners and published on our website. And also we are in the process of creating a Tier 2 information sharing agreement, which will be detailed around the integrated front door and the MASH that is incoming, to make sure that we can get information sharing correct in that area. You'll see that our partnership multi-agency safeguarding arrangements were published in December, and within that we've got an ambitious scrutiny plan where we've decided that instead of having one independent scrutineer for the partnership, that we will have multiple independent scrutineers that are focused on topic specific areas where they can come in with the expertise for each area and provide some really good insight into those areas for scrutiny. And also within that scrutiny, we've asked our young safeguarders, who are young people within the city who meet and help to review a lot of our safeguarding work, and they will also be being independent scrutineers as a group as well for our partnership as a whole. to give them more insight into all the elements of the partnership, but also so that they can tell us from a young person's point of view what we need to be doing better and how we can improve. And you'll see there that I know that Andy touched on analytical capability. It has been an issue within our partnership as well. We are data rich. We have multiple areas of data from all of our partners. However, putting that into one place and having a data dashboard has been a real weakness for us. Therefore, our delegated and lead safeguarding partners have agreed that we can recruit an analyst for 1 year on a fixed term contract, where they will then produce that data dashboard that then it's felt that after that year it would need to be populated rather than created. So therefore that's why that's for 1 year only. And I've already touched on our level 1 and 2 partnership training. I've talked about our health check and how we've previously done that. We are redoing our health check in February 2025, just so that we can see where we still have rooms for improvement, but also to see where we've actually closed that loop and where we're now becoming stronger. It gives us an idea of where we are. You'll see that we are currently completing a joint child safeguarding practice review with Devon, and that's being completed by a GP in Somerset, she has offered her services free to Plymouth to do that report, and we will reciprocate with one of our child safeguarding practice review members as well, panel members. And that will then be shared with the national panel in March 2025. And you can see there about obviously we will have a robust implementation plan for action. I've talked about our tier 2 safeguarding sharing arrangement and obviously our data dashboard as well. So finally, we have a new senior project officer being recruited into our partnership team, just to help to deliver on a lot of the work that's being created within the partnership, to help and make sure that we can look at those further sort of connections within the city to make sure we've got the right people representing on our partnership as well. I know that when we were at scrutiny panel last year, then we were asked around faith group attendance within the partnership, and we have been working on that to make sure that we have better representation from our faith groups in the city on the partnership. And finally, just one more thing that has come up quite a lot recently was around online harm. Where is online harm sitting within our partnership? And we've made a decision that online harm will sit within all of the groups on the partnership, because actually it affects every single area of the safeguarding system. And therefore, it is the responsibility of each chair to ensure that online harm is held within each group within the partnership, so that we can see and develop that in each of our safeguarding areas. I tried to keep it as quick as possible. But yes, if anyone's got any questions.
Thank you very much indeed. That was really informative, and to me it's always reassuring when it's areas that you don't actually work in to know what is actually happening, isn't it? So, any questions? You've stunned them into silence. This must be a record. Michelle, what input does Live Well have? Because obviously I can't question Stuart because he's not managed to get to us. But
we are represented on the safeguarding board by has been got.
oh yes, of course. Yes, well I know Ian goes to the adult one because I see him there. But right, that's important, very important. Tony, do you get much coming through Health Watch about safeguarding?
I guess from our perspective, it's the feedback we get is kind of that alerter training that we undertake as staff, identifying individuals. We don't see hardly anything around children, but certainly from an adult point of view, we've made referrals in the past around that. Sometimes you can pick up some themes as well.
Thank you. Anybody else want to make a contribution? No? Okay, folks. So there's a recommendation that the Health and Wellbeing Board are asked to note the report. And I do think this is something that we need to have coming back, because I know children's take the scrutiny, the report to scrutiny, but I'm not totally convinced that we do for adults. So I think it is useful, and to link it both in, especially where you're looking at transition as well. So thank you very much indeed for giving us your time today. I do appreciate it. Right, Chris, you've got the last effort here, haven't you? So I'm sorry that you sort of the last thing where people might well be looking at the clock, but thank you. Update really welcome.
Thanks. I'll try and finish on a high. Let's try that. So I mean, it's our regular update in terms of some of the key headlines coming out of NHS Devon and the health system. I won't go through them all. I'll just pick out a few, recognising the time as well. So first one to mention, there's reference in terms of our organisational change process. There's a number of things that are taking place within the ICB currently. But one thing that I can update since we put this report in, that Kevin Orford has been confirmed as our permanent chair, which is really, really positive. He's been our interim chair for since Sarah left, and is well known to the ICB and the local system as a non-exec director previously. I know he's really keen to come out and meet with the Health and Wellbeing Board chair and spend more time in Plymouth now that he's permanent in post, and I know that's something that he'll be taking forwards. The other thing to mention, so winter pressures, we're very much in the depth of now, aren't we, in terms of continues as predicted to be a difficult and challenging winter period, and particularly soon after Christmas there was a particularly pressured time in the hospitals across the whole of Devon. Real strong partnership working that we continue to drive in terms of supporting people to exit hospital as soon as possible. Find ways to support people in the community through different routes as well, which meant that we did quite quickly return back to normal activity, but it does continue to be a pressured time for us. There are within the report a list of reminders of what us as citizens of Plymouth can do around making use of 111 pharmacies, staying safe during the varying weather that we get, be that cold, wet, windy, all in the course of one day, isn't it, at the minute? Doing our part to help where we've got loved ones in hospital as well, to take them home as quickly as possible once they're fit and ready. There was an ask previously around considering, as part of that and the pressures within the hospital system, the role of primary care and some of the challenges that people may be experiencing. I think it's something that we continue to recognise the pressure that our colleagues in primary care are equally facing as well, which also comes at a pinch point during the winter period. There is some work that we're doing to look at where we've seen growth in activity within the emergency department and support and work with those practices that might be having more of a pressure than others. There's some additional investment and support that's gone into one of the primary care networks as well to help in terms of some additional capacity. That's something we continue to look at and support. You've mentioned already, Chair, around the 10-year engagement event, so it's a further plug for that in terms of encouraging people to come to that on Friday. As you mentioned, there's the workshops that we'll be holding in the Methodist Church, but also a drop-in session all day at the library in the city centre. Would encourage people to come along and talk to us. We'll be there all day. And then the last thing I wanted to mention, it's a good news story in terms of our improved discharge capacity around Pathway 1. So people have heard me talk in the past around our intermediate care plan for the city, how we're really driving in increasing the number of people who are discharged directly home rather than going through bedded pathways. We know that's best for people, that there's better outcomes for individuals when they're supported to return back to their own home as quickly as possible. Through our joint work with Plymouth City Council, commissioning colleagues, Live Well, University Hospitals Plymouth, and our voluntary community sector in terms of the assisted discharge service that we've got, we've seen a real significant increase that's really starting to take effect now, with a 150% increase in terms of the proportion of people who are discharged directly home rather than in a bedded setting compared to last year. We've got more to go, but definitely starting to see some of the success around that, which is a really good news story, particularly at a time when we're at our most pressured as a system, that we've been able to hold our form around that.
Thank you, and certainly I can add, I had a meeting with Mark Hackett, who's the Chief Exec of the hospital, the other week, and I, as you all know, I get very irritated when I'm told that there's all these people waiting to go home, and it's all the adult social care causing us. And he was very complimentary about our social care teams here, and in fact he said we were really up to it, and there was very few of ours that he had a concern about. It was some of the other users, shall we say, of the Derriford, whatever, that were causing more concern, but no, very complimentary about the fact that we were making sure that the service was working well, especially during this time. I think one of the other things sort of linking in really with public health is we always have an update on the winter pressures, etc., and the plans for the winters. So obviously what's happened over this winter, where we've had the 4 illnesses hitting sort of at the same time, there's going to be interest now in how we plan for next year and the uptake of the flu vaccine. And I mean, COVID's not been quite such a problem, has it, but it's how do we plan and how do we protect the workforce as well as our vulnerable people out there. So Stephen, I don't know if you want to say something about that as well, just before we move on.
I talk about it like it's a very well produced idea, but actually it's very much an embryo, but it's work we've done elsewhere. So I think we recognise the challenges we see locally in Plymouth around vaccine uptake, not only in our residents, but also in our workforce. And I think the recent critical incident that Derriford had seen highlighted to us that a number of people were presenting and being admitted for vaccine preventable illnesses. So there's a real ambition from my perspective, and what we do, we're always preparing for next winter in winter. It's just the way we flow, isn't it? But I think there is something the public health team can do. They don't know it yet. Sorry, Teresa, just looking at you over there. Around how we really start to prime that agenda. It will be part of a bigger programme around general promoting vaccination throughout the life course, but I think there's something we really need to be doing jointly with the hospital and other partners in the room around how we up that vaccine uptake, both in staff, the general workforce, but also our residents. So.
Michelle?
I couldn't agree more with that, so I'll be there to help. I just wanted to emphasise what Mark Hackett had said to you, really, that the difference this year for people being discharged to Plymouth, we're right up there, like top 4. I want to say number 1. I want to be number 1, but we're top 4 rather than bottom 4. As we've been historically. It's so different, and you will start to see over the next year as well more and more about that prevention of unnecessary hospital admissions. So doing a lot of work around that, and actually just making sure that the acute hospital has a focus on the people who really need to be there. But it's really, really different.
Thank you. Anybody else wish to come in on that? Jemima?
What's been the key to that performance? I'm just interested in how that was achieved.
Emma?
I think some practical solutions, but I think the sort of enduring spirit of partnership working generally, and that ability to get people around the table and without a culture of blame, and just say, this is our shared challenge, and we treat it like a shared challenge. We're also very fortunate with our care providers in the city. They work tirelessly, as you know, Mary, to support us. Our waiting list, we track performance very closely as well. So we know, for example, our waiting list for people to receive domiciliary care in their own home has held steady at about 28 to 89 people waiting a week. At the height of the pandemic, it was closer to 300, I think, people waiting for a much longer time. So all parts of our system feel that they are working better, but there is that absolute shared endeavour. And when we get stuck, whether that's because we need to respond differently for an individual person or for a bigger part of the system, we get together and we sort it out. Politely behind closed doors, but we sort it out.
It's really been interesting to watch how this functions. It really is. Chris?
Just wanted to kind of build on that. I think so as Emma describes, that recovery and that partnership working is really key. I think we're also really brave, if I'm honest, in terms of we over-commissioned our home-based care in order to build that confidence that it would be there, that practitioners could be assured that if they referred people out, back home, that there would be support available. And I can't underplay the kind of the process cultural shift that our partners in the hospital and with support from Live Well have really driven in terms of changing that approach to make sure that people are aware that that offer is there and the support arrangements that are there for people within their own home that enables them to go back.
And it will be interesting to see what the hospital have found with the change in their contract for pharmacy provision, whether in fact that has made life easier in getting people, because we well remember people saying, oh, they need their medications before they can go home. That there's much more innovation now, isn't there? So, you know, that's helpful. So that'll be good to have. So anything else? Emma?
Yeah, just to say, I think that's a really good point in that we know and we know quicker these days. So if there's something that starts to not quite work, whether that's something on the ward, something out in social care, whatever it might be, we've got all the systems in place for us to be able to respond to that, and we'll see it very quickly, both through our data, but also the feedback from the wards particularly as well. People will tell us, and Chris's point is absolutely right. We can say to a blue in the face, the support is there, but unless the staff feel it, and when they need to refer to a service, if it doesn't respond, then that quickly unravels. So Chris is absolutely right. We've taken some brave steps. We've almost oversupplied some areas to make sure that that confidence is there in the system.
And Rob, from the perspective of carers as well, we've done a lot of work with carers, haven't we, to make sure that they are feeling supportive, and if there is problems that they know where to go to get the help they need, hopefully. And I think there are some people that are stubborn and won't get the help, but I think, or ask for the help. So I think that work goes on all the time with your organisation, doesn't it? And with the other voluntary service organisations out there.
Yeah, absolutely. And it's also making me think about more targeted, assertive outreach work with some of our more vulnerable service users. I think I really would want to do a bit more of a deep dive around targeting some of our services a bit more. And also, Chris, is this I suppose what you're reflecting on? Is it emerging changes in practice, quite fast moving, and you're learning quite fastly to adapt? And this is all starting to influence your thinking around commissioning and the design of services, assisted discharge services, and how you can learn from very recent events. Yeah,
absolutely. I think it's taken the time to get there in terms of the work and the shift, but it's really getting momentum now. And you're absolutely right. There's a lot of learning that we can take from this, the work that we've done, in order to inform some of that thinking around some of those other services. As Michelle referenced, the drive moving forwards around how we kind of take that on and build and use the learning there around our emission avoidance and how we're supporting people much further upstream, and particularly around some of the voluntary community service support that we've had focused around discharge to date, thinking about actually how we can reshape some of that in order to support people at an earlier stage so they don't even need to come into the hospital.
And this comes back to Zoe and the community builders, the community empowerment and all that. It's quite cyclical, isn't it, that all of this needs to be in place and functioning, and how much of a difference it's made over the last few years. And obviously we will look to see, we hope that there will be improvements, etc. And that confidence, isn't it, in people, whether they stay home, whether they go into hospital, all of this, hopefully will help in that. Thank you very much, Chris. That's very welcome. So we are asked to note the contents of the report. Moving on to tracking.
Thank you, Chair. Just two to bring your attention to. The first one was into a request for information regarding Health Watch. Tony's provided an answer within your tracking decision logs, so I'll mark that one as complete. The second one is for Chris and NHS Devon, 2/3 complete. The only one maybe for further action is the third one, which is around further information regarding admissions to ED due to challenges accessing GP services. I don't know, Tony, if Health Watch are going to recommission the survey of ED at any point? or if that can be used as statistics.
It was the last two times we've been in was at the bequest of NHS Devon, so Healthwatch have got no priority to do that at the moment. Obviously, if NHS Devon wish to revisit, then we would consider.
Thank you very much. And then the work programme. Some of the things that are on there we've already covered. So I think Steve, I think we probably need to look at what's there and tidy up between Elliot, yourself and me. We need to tidy up what's there because there are several bits that we could take off now, can't we?
Just through you, Chair, for the next meeting, we've had a request from NHS Devon to bring the joint forward plan. It needs to be published to them by April, so they would like to bring it to the board first for comment. I've also provisionally scheduled suicide prevention, which is an annual topic for the board, and we haven't had this year. Flip into the back, we've also got the annual update on the Plymouth Health Determinants Research Collaborative. So that's another one we can discuss at the agenda set. Thank you.
And obviously, if anybody thinks of something, please let us know, and we can add it in. And obviously, there's always the curveball that comes in, isn't it? That we don't know, we don't know now, but a couple of weeks' time something comes in. So please let us know. That's the whole idea of making a difference here with this. Right, well, I can't believe it. 1 minute late. That ain't bad. At one time we were about 25 minutes late. So I do appreciate all your time. And we will make sure that we don't fit anything in around 12 o'clock, that we will actually go continental and make sure people's lunch breaks are preserved. So thank you for your time. We do appreciate it. Zoe, thanks. And I think I think all of us have learnt a lot from the reports you've put in, so thank you. Thanks, folks. We'll see you in March, is it? I think it is. I've lost track of dates now, but see you soon. All right, take care.